The mission of justice is to see that the guilty people are proven guilty and that the innocent are freed. Only we have a problem here.
Welcome, welcome, welcome. We are taking a look at this case from a psychological perspective.
Fun. Everybody was having a good time.
Does Brian Albert strike you as the kind of guy who is always having fun? No. And here's a news flash for this judge. Mental health professionals have solutions.
They made an arrest. They got the guy for Danny.
It's like a mix between sadness and anger, because that's the moment for him when he really started to believe that his mother was involved.
The only corresponding records in the other databases are from previous days.
There is a huge psychological component to what was going on here. And according to this group, Brian Albert Jr. gets like the most celebrated birthday hour of anybody ever. Like every 30 seconds, someone's like, "Happy birthday!" John totally seemed like such a cool guy.
John makes me like
Somebody jumps in as a journalist, draws attention to it in a light that is not good for the prosecution. I mean, and there are serious allegations of corruption in the DA's office and the state police.
It's not like his 21st birthday. Hi, loophole lawyer. How are you?
I'm great. It feels good to be back.
I'm going to go with this yours, because certainly I've gotten a lot of love from everybody today, which feels nice.
You are very, very loved. And I can't believe we get to spend your birthday with you. Happy birthday!
Text messages read back as if he's the aggrieved party.
Hold on. Have each of you been called murderers?
Who wants to be the one to give Matt the bad news?
I wanted to prove, or to demonstrate.
I don't know where the dog was. I didn't hear any barking. Her name is Sunny. She was named after Santino Corleone.
This is his face.
Say hi, everybody. There's my Johnny. Hello. That's my Johnny.
Sunny barks if you walk by my window and sneeze. You're not really going to deny this, are you?
it's so weird. It's like the Inside Out, upside down in Narnia.
I would get at some point in time and fashion and then turn it over.
Know if we had it enough, or we had it all, I should say.
Kill me. Not having the observable or detectable electrical activity would be asystole.
Means death. 3 separate tab IDs. The thing he had to encourage her to do was not to testify.
You know, and Julia Albert responds to the text message from John, and she goes, "My biggest fear in life is ending up on Turtle Boy."
Stop it.
Oh, you never seen that? Oh, I got it.
You're not going to like this, though. You're going to disagree with me on
Just say it. I like the
disagreement.
conflict.
Okay.
Yeah, the disagreement.
Let's say the Commonwealth of Massachusetts.
People are terrified of him. They're absolutely terrified of him. And how do we know that? We know that from Mega Motion. Just another day for me, right? Which means it was just not an ordinary day for somebody else. Just when you thought you were out, pull you back.
Karen Reed plots. She fabricates a conspiracy.
I am just a person who likes to understand. That's going to increase the likelihood that we're going to take some action.
Here she is.
My sister Jillian, yes.
It's funny. But then he's got part of his shirt untucked. His back pocket is kind of hanging out.
He has to buy that. So, he has to buy that. So,
And showing solidarity, you can see them there.
It's about getting justice for John O'Keefe. There clearly is an issue of integrity.
How dare they?
justice for all. Only we have a problem here.
Hello, welcome. Hi, everybody. Welcome. It's our special Monday Night Live hopefully you can hear me because I had some technical difficulties. I had to meet with my professor, and I don't know if you guys know professors, but they can be a little long-winded. So I'm like trying to be as kind as I can and as gracious. And I'm like, okay. I gotta go, so thank you for your patience. Hi, everybody. Denise may be making an appearance. Everybody send your heartfelt prayers to her bunny, Bugsy, who had to have a little procedure today, and hopefully he will be on his way to a speedy recovery. My sister's going to be in the chat helping us tonight. Hi, guys. What a day, though, in this Lindsay Clancy case that has captivated all of us. I knew that Wednesday night we were going to have way too much to do. So I said, you know what? Let me schedule something for Monday where we can talk only about the Lindsay Clancy case, because I have been doing my homework on this case. Of course, you guys know me. I'm trying to figure out what the hell is going on with this woman, right? What is going on here? Because certainly this whole argument about that the prosecution is trying to make whatever they're saying their argument is, I can't even tell, right? They're denying that it's that she's faking, trying to end her life. Okay, whatever, I think probably what happened or what's happening is that they're getting wind that their story isn't landing. And so they're trying now to backtrack a bit and make it sound like, no, that's not what we were trying to suggest at all. That's my guess. Note, they won't tell the judge publicly what it is that their theory actually is. So that should give you some clues. Because if you don't know what your theory is, I don't know how you expect the jury to know what it is. But nonetheless, we have had some very interesting couple of days of testimony. And I've been doing my homework because, like many of you, I want to know what the hell really happened. That's really all I care about. The truth, right? What happened here? Because, and I know this is obvious, but I think it can get lost, and it certainly can get lost with this prosecution. People don't end their children. It just doesn't happen, right? That doesn't just happen. It's not even the kind of crime where, you catch your, I don't know, your husband with their lover in your bed, right? That kind of rage-filled anger where somebody's, brought to the brink and does something they never could have imagined. That's not what we're dealing with, right? We're dealing with something that is just fundamentally, from an evolutionary perspective, not in our DNA to do. So it's not in our DNA for a reason. It is not advantageous from a survival perspective to take the lives of our offspring. There's something exceptionally wrong with that act. Period. And it is so extremely uncommon that I think even for these professionals who we are hearing from, who treated Lindsay Clancy, they did not have it on their radar. Now, whether they should have or not is another conversation that we'll get into later, because I do want to, we're going to go through some of this testimony, because as a mental health professional, I'm freaking out listening to this, hearing things that I know people that are not working in the field do not have an awareness of. And of course, as I said before, the prosecutor's just letting it, fly by, hoping that we don't catch it. And it's big stuff. Like, from a civil perspective, a civil suit perspective, the fact that these providers did not communicate with each other is unimaginable. It's especially McLean Hospital and, of course, Dr. Tufts, but that's a little bit of a different discussion. The fact that McLean Hospital did not contact her treating psychiatrists, doctors, nurses, whoever, is uneffing imaginable to me. It's unthinkable. It is absolutely criminal. And this is something that we all deal with all the time. So the fact that these doctors are pretending like they can't even imagine making a phone call, getting a consent, a release signed from their adult client, and then make a call to a husband or to, God forbid, another provider, the fact that they're trying to make that sound like it's unimaginable is ridiculous, right? That's how you know these people are on trial to save their behinds, because it's bullshit. That's just total and complete bullshit. So, it's frustrating when I'm hearing this stuff and I'm like, she's lying. She's lying. She actually had a note, you guys, in the system that, the automatic system that says that she was communicating with collateral, that she was collaborating with other professionals, and it was like automatically checked, and she blew right past it. She's like, oh no, that just auto populates. I'm like, no, that's not an auto population. You have to select that. Who is the person that you were allegedly communicating with inside the note, right? So there's some dishonesty happening from Dr. Tufts today, and I'll point it out. I don't know if we're going to get to go through all of it, but I will point it out when I see it. And I get it. Part of me felt for her, because I'm imagining some of my colleagues and friends in that seat. Mental health professionals are mostly, I would say the vast majority of us are very well intended. Certainly nobody wanted this to happen. And if they could go back, they would, of course, not do it the same way. So I feel a little bit for Dr. Tufts. But obviously, trying to sell yourself as having some particular expertise in this field and then not recognizing when somebody is having a serious psychiatric crisis emergency of the highest level, letting that just go right by you. And that's what happened, guys. That's what happened. She missed it. And I'm going to show you all of the moments where that becomes very obvious to me that Dr. Jennifer Tufts missed it. She missed it. And there were a lot of opportunities here for these mental health professionals to communicate with each other and have rerouted the history, in my opinion. There was a lot of opportunities for them to communicate with each other. And the fact that they're trying to put that on Lindsay Clancy and say, well, she was so good at this. She was so good at being a patient and saying all the right things. Well, it's like, yeah, that's part of your job to figure out, isn't it? Isn't it part of your job to be able to figure out when somebody is saying all the right things versus when somebody's doing all the right things, or who's being 100% honest with what's in their head? So this was pretty frustrating for me going through it. And I realized that my perspective is going to be skewed because I'm able to see the notes in a completely different way than other people. So there's that. But I've also been doing my research into postpartum psychosis, postpartum mental illness, to try to figure out what is really going on here. And does this diagnostic picture a postpartum mental health crisis? Is that what really happened? So before I give you my opinion, we're going to go through it together so that you can see exactly what I think really happened. Now, I can only tell you without more history. So I realize that if new information comes in, it could change my opinion. It could change the way I see this case. we don't have a full history of Lindsay Clancy, and that's a challenge to try to piece together what's going on from a mental health perspective without the full picture, guys, is like, it is really tough. But you know what? That's exactly what these people that treated her were doing, because they all acted like she had never existed on the earth before the day that she was in front of them. That's what they did. How do you go into McLean Hospital? This is supposed to be like the premier treatment center, certainly in Massachusetts. But McLean has like this prestigious reputation, particularly for postpartum, by the way. I actually have had clients that's where they went for postpartum depression, to McLean. And not communicate with her psychiatric providers before she gets to the hospital? How do you not do that? And you can say what you want about the lack of experience in Dr. Tufts, but Dr. Goodhart knows better. That woman has plenty of experience. She knows better. It's a disgrace. It's very sad. Very, very sad. Very, very sad. Hello, my sister. My sister is in the chat. Hi, Jackie. Thank you for being here. Thank you so much for being here, because my dear Denise could not. But also, join my sister and I on Wednesday. We're going to be doing my sister's launch party. So that's going to be very exciting. I can't wait. Wednesday night, our usual time. Don't miss that. So let's get started on this. I'm going to play some of the testimony, some of the highlights, if you will. And we are also going to hear from women later on, a little later on, who are going to tell us what their experiences of having postpartum mental illness, what that was like. And I will tell you some of the statistics. Very interesting. It's about 50-50, 50% of women who have this type of mental illness, postpartum mental illness, which falls into a couple of broad categories, but ultimately it is anxiety, depression, OCD, postpartum psychosis, postpartum kind of panic disorder, which is kind of in the anxiety camp, a postpartum PTSD that comes, let's say, from a really challenging birth or some type of terrible trauma. Baby is very, very sick when born very sick. And about 50% of women who have a postpartum mental illness never had any signs or symptoms of mental health, anything, or had it in their family. So it just comes. And of course, this shouldn't be a surprise to any of us, right? Because your brain, your hormones are completely altered during the pregnancy and in that postpartum period. Your brain is doing the neural pruning to prepare you to be a caregiver to a baby, to make their life more important than yours, right? So very interesting, 50%. And the numbers, guys, a lot of the research seems to indicate that these numbers right now, postpartum psychosis occurs in about 1 in 1,000 women. But there's some who believe it's probably much higher, but because women are so embarrassed about their condition, embarrassed that they're not, experiencing such joy with their newborn, that they don't tell anybody and they never get treatment and they kind of suffer through it on their own and fortunately make it through to the other side. So it's probably higher. But that's actually pretty high, 1 in 1,000 when you think about it. This is postpartum psychosis specifically. So we're going to look at all of this much more closely. And I want to say, in case we don't get to it, because there's a lot, on redirect with Dr. Tufts, the prosecutor was asking about psychosis, and the good doctor made the comment that, well, postpartum psychosis shows up exactly like any other psychosis. That does not appear to be what I am hearing. So I wanted to throw that out there. Just wanted to throw that out there. These women seem to have a lot of crossover in their experiences of having postpartum psychosis. There's a lot of themes. And to their husbands, to their friends, to their family members, the vast majority of the time that they're experiencing psychosis, guys, nobody sees it. They're not evidencing mania. They're not drooling on themselves. They're not out of control, with pressured speech, and their eyes are all crazy, like the way that she was trying to present mania today. And I'm very familiar with mania. Believe me, I know what psychosis looks like in the traditional sense, in the bipolar sense that our good doctor is trying to present. This seems to be a little different. These are all very important facts. And now I understand why Rennington was saying he wanted to bring on people who have had this experience to the jury. Because as soon as you hear these experiences, you realize, like, oh, this is its own animal. This is something a little different. And the way that she's presenting it as exactly the same as, bipolar psychosis, no, that doesn't check out. Our expert does not check out. Oh my God, you guys. Hi, everybody. I'm trying to figure out. So I screwed up. I'm back in New York City, you guys, and I forgot my computer keyboard and my mouse. So I'm trying to use this backup. And I'm struggling to figure out how right now so that I can show you guys on the screen. So patience, give me a moment while I try to work it out. Here we go. Okay, I figured it out. Yay! I got a bad feeling since 99. Oh my God, you didn't have to do that. Thank you so much. Samantha, thank you for spoiling us with amazing content, even though you're on vacation. Not only do we appreciate your professional opinion, but your honesty, no matter popular opinion or not. You explain complicated matters in a way that makes sense. You are the absolute best. Oh, much love. No, thank you so much. That's truly way too kind. Thank you. And yeah, I mean, I hate when my opinion is the unpopular opinion. I hate it. It's my least favorite thing because I want to be able to say what everybody wants me to say. I really, really do. It breaks my heart when I have to have the unpopular opinion, but I'm gonna call it like I see it because that's just who I am. That's what I have to do. But I'm also going to try to get as much information before I have any opinion. And if I have questions, I'm gonna go try to dig out the answer if I can help it. And I don't feel like, I'm starting to feel like I am understanding who Lindsay is. But for a long time, she was just a big question mark because the prosecutor is just, giving us this cookie cutter understanding of her. She's this great, perfect mom. It's like, who goes to the gym a lot, right? I mean, that's like what the prosecution is saying. She's this perfect mom who goes to the gym a lot. Okay, well, that doesn't really give us much. And certainly, this is a complicated person who commit the unthinkable and unimaginable act. So the story that, like, you're just all of a sudden turned into a sociopath who M's their 3 children, so that's just not what happened. I mean, period. That doesn't happen. You do not M your 3 children and then launch yourself out of a window at 32 or 33 years old after having been, a well-adjusted, healthy woman for 33 years, person for 33 years. That's not a thing. So something happened. Something happened, right? And that's the question. What the hell happened here? And I think we are starting to get closer to the answer. That is my assessment of the situation. So, thank you so much. Got a bad feeling you're amazing. And thank you all for being here with me tonight. At Coco Gaga 2 sends the floating heart and 10 jewels. Thank you so much. I wish you guys could see the things because they're so cool. I guess you do see them. I don't get to see them, but you do. Then we got an uncler, which I don't know what it was a response to, but thank you so much, Suzanne9204, and a silver star and 2 jewels at Nadia Crook 5627. Thank you so much, Nadia, who sends also sparkles and 2 jewels. I do love them. I do love these things. I don't know what they're called, but the like emoji chat things. I like get a little carried away with them when I'm in other people's chats. I'm like pushing the button. At Navy Girl 2478 sends 1,000 jewels and a trophy cake. Thank you so much. And look at those beautiful puppies. Oh my God, how cute. Thank you so much, Navy Girl 2478. All right, let's get into some of this testimony because we will never get through it if I don't just get started. And I promise I will continue to get to you guys all the way through. Here we go.
You do a lot of different things. You rotate in all the different aspects of psychiatry, as well as internal medicine, so that you have a foundational knowledge of broad medical topics. You admit patients into the inpatient hospital. You manage emergencies in the hospital and in the emergency room, decide whether patients need to be admitted psychiatrically or not, and also carry a panel of outpatients.
So obviously the first thing that Reddington does is point out that Dr. Tufts is young, and young is really an understatement, right? I mean, I heard somebody saying that she was a doctor for a year. It turned out her very first job out of residency was basically her first patient is Lindsay Clancy. She gets hired in August. Lindsay starts mid-September. I mean, it's like almost immediately she gets hired into this practice, this Astor practice, and is working with Lindsay Clancy. Now, it's true that your residency is a robust experience. She, I'm sure, did see thousands of patients, but obviously she's young. And it's hard not to consider that that is likely a factor. And for all the reasons that I have already said, you know, over the last few days in the couple of videos that I've done on Dr. Tufts, there are ways that experience trains your eye to see things differently that you just can only get with time. That's just for the reality of life, right?
Is this a hospital that you're working in, or is it Boston University? Is it a medical center?
So yes, it's the Boston University program, located at the hospital, Boston Medical Center, with also a lot of time spent at the various Boston VA locations.
And what were the years, I'm sorry, that you did your residency?
2018 to 2022. Well, you're actually a licensed doctor the entire time that you're in residency. But upon the completion of that, you can obtain a full, unrestricted Massachusetts.
The other thing that I should just say, in case some of you didn't see the videos that I put out, the two ways that I do think that this inexperience is really a problem in this case. One, Lindsay and this doctor are peers. That's a problem because, and I'm going to get into this more as we go along, I suspect that Lindsay Clancy's personality and the fact that her anxiety was just getting worse and worse and worse created a situation where she really needed a trusted authority figure to come along and tell her what to do. She needed somebody that she could trust to say to her, listen, I got you. We're going to get through this together. Trust me, right? And to look at this young person who's essentially the same age as you, you're not going to inherently, that doesn't foster that, that type of dynamic. It's not impossible to create that, but you're going to need lots of time. And that's the problem. Is it impossible for this doctor to have created that relationship with Lindsay Clancy? No, but it wasn't going to happen while she's in the midst of a mental break and really needed somebody immediately to be in that role of a trusted authority figure for her. So she obviously felt some type of affinity for her because she stayed with her. She kept going back to her. But that's the one way I feel like, Lindsay would have been much better served with somebody who did have a lot more experience, number one. And number two, younger doctors can be more savvy. I said this before about medications. They can know the newer stuff, the newer technology, the newer treatment interventions. So there's some benefits sometimes to the younger, newer doctors. The problem, though, here is these symptoms were not expressing in a textbook way. And if you are looking for the DSM to tell you what's going on with Lindsay Clancy, you're going to be in trouble because it's not going to show up in those nice, pretty boxes like we would all like for them for things too.
License and also become board certified. I started working as a physician and as a psychiatrist during the residency training program, but I started practicing completely independently at Astor Mental Health in August of 2022.
Congratulations, obviously you were hired by Astor. How many women
I love he
have
says
you treated
congratulations.
in your residency that were postpartum?
With postpartum depression? Or just in the postpartum period?
How many women that were in the postpartum period did you treat prior to August of 22?
Many. It's hard to give an exact number, but I did have specific training in that population.
You haven't talked to the
Yeah, this is something we have to talk about. It's been driving me nuts, okay? It's been driving me nuts. None of these treating professionals were diagnosing her having anything to do with postpartum. So now the doctor's saying, oh, well, I agreed with yesterday or on Friday, she had said on direct, well, I agreed with Lindsay's decision to go to seek treatment in a postpartum clinic, a clinic for postpartum mental health. But there was no diagnosis of postpartum anything, not from her, but also not from anybody else, which is very interesting. And nobody's bringing that out. I guess maybe for obvious reasons from the defense side. But it does strike me as a bit odd. Now, here's the thing. And this is, again, remember what I was saying a few days ago about process and content, right? So as a treating mental health professional, I am always looking at process. How does somebody show up? Like everything about them, right? Without even knowing it. Like you're just analyzing every move that somebody makes. You're just taking that as information into your brain, trying to make sense. Who is this person? Who is this person? Who is this person, right? Then there's the content. Okay, what they say, the people, places, and things that they are communicating to you about. That's probably what, a fifth of all of the information that you're using to try to assess who the person in front of you is. Now, our good doctor doesn't get as much time as I would if I were working with Lindsay, because I would use in the full hour. I have tried my entire career to do 40 minutes or 50 minutes like some of my colleagues do. I can't do it. I just gave up. I need a full 60 minutes. It is not enough time. That is my opinion. I don't know how anybody, the fact that she's even using the word therapy and 17 minutes in the same sentence is asinine, is absolutely asinine, as Kevin Reddington is pointing out. But it is very odd that there is no acknowledgement by any of these treating professionals of the postpartum piece. And as Link E 4483 is pointing out, she was prescribed a lot of psychiatric meds in a very short amount of time, which we'll talk more about in a minute. But there was no discussion about hormones. And that's where this whole postpartum piece comes into play, because that's what postpartum is, right? Your hormones after you give birth literally plummet into the toilet. And obviously, yeah, it's very challenging. You know, it's just a very challenging time having a newborn baby at home. An 8-month-old, a 2-year-old, a 3-year-old, and now imagining having all of them at once. You know, obviously it's a very challenging time for the best of us in our most healthy form. So there's nobody arguing that it wasn't very, very overwhelming and a very challenging time. But the fact that they're not acknowledging it is really bizarre. It's bizarre because you can diagnose throughout that first year after somebody has a baby. So why is nobody acknowledging this postpartum period? Now, this is a question because it makes me think, well, are they believing, does our good doctor believe then that Lindsay's anxiety is only because she's going back to work? Right? Or is this just a diagnosis that she was given because she has to put something down for insurance? We don't know. But these are the questions that are kind of coming into my mind as we are going along. Let me press play.
Office?
No, not at all.
You're a defendant in a very large lawsuit, are you not?
Yes.
You wouldn't happen to be represented by an attorney, would you?
I am.
And the fact that you have an attorney is your right under the Constitution. It doesn't mean that you're guilty of anything, right?
Right.
Okay.
He was very good today, right? I mean, I thought Reddington was so entertaining, but just, you know, kind of shamelessly letting her have it. For better or for worse, she handled it as best as I think you could. But yeah, she is on trial. There's a civil case against her. The judgment, the outcome of this case directly affects this woman's life forever. It affects her ability to continue to be the medical professional that she is. How do we not even acknowledge that? Of course, it's going to affect her answers. If she tells the whole truth and nothing but the truth, she could incriminate herself, right? I mean, she is incriminating herself. That's certainly something we have to always keep in the back of our minds. It's to me, it's just so very evident. Hello, dear Mark. Mark has joined us. I've missed you. Mark sends 1999. Hello, Sam. After being off work for 2 months, I went back today only to find out they haven't received my release yet. Laugh out loud. I missed a few of your videos only because the subject really makes me sad. Nothing to do with you. Well, I so appreciate you being here at all, Mark, as always. And I'm glad to hear you're back at work. I mean, well, I guess soon, not today, but that's good. That's probably a very good thing. Always appreciative of you, Mark, whenever you're here. whether it's a sad or happy topic.
And you know that the outcome of this case is very, very major to the outcome of your lawsuit.
I don't actually know that.
So you understand that if, in fact, it's determined that you advertised as an expert in postpartum and in postpartum psychiatry, and you've had a month experience plus a residency, would you consider that to be negligent or misrepresentation?
I do not believe that I have been negligent.
Do you understand what misrepresentation means?
Yes.
With a month under your belt plus your residency, do you really want this jury to believe that you were an expert? You advertised that?
I don't think that's exactly the wording that I used. I think I said that it was an interest of mine.
You were what?
The answer? No. Go ahead. Good. The answer.
I just think the wording was that it's an interest of mine. I don't believe I called myself an expert.
Are you an expert in postpartum?
I may be. I don't know. I think it depends on what you define an expert as. I couldn't see her legs, but I knew that she was under stress.
What brought Lindsay Clancy to your office?
Postpartum anxiety.
Okay, so here she's saying postpartum anxiety brought Lindsay into the office, but that's what Lindsay was saying brought her into the office. And I will point out, although Reddington really didn't touch on it, because I think he probably didn't understand it enough to use it the way he probably could have, because it really could have been a battering ram today. Her continual report that Lindsay did not have insight. That's a really big deal from a clinical perspective, because to have insight means that you understand your condition. You understand your mental health. You understand what's happening for you and to you and with you. And while all these people are trying to tell us that Lindsay was so good at, the lingo, and she kept lists and she kept me up to speed on everything that was happening, to also simultaneously be saying that Lindsay has poor insight, something is very wrong there. Those two things do not go together. They are incongruent. So the good doctor is not being honest. And there are plenty of times throughout this testimony where it's very clear to me that she's not being honest. Maybe that's the wrong word, transparent, that she's not really telling the whole truth, that she's glazing over things on purpose because she doesn't want to incriminate herself. And it's not a few times. I mean, it keeps happening over and over again. So this piece about Lindsay lacking insight is a giant red flag, because at the same time, we're being told she's so good at this. She's coming in prepared. She has knowledge. She has understanding. She's able to advocate for herself. She's showing us that she's, she shouldn't be on a Section 12. She's mentally alert. She's, advocating for herself. She's calling her family in to make sure that everybody's safe. All this BS. But then we're hearing from Dr. Tufts over and over again, Lindsay has poor insight. Now, why am I saying that? Because Lindsay's saying to us, telling the doctor that she's coming in for postpartum anxiety. That's Lindsay's language. But the doctor is not saying that. She's saying that she has adjustment disorder with depressive symptoms going back because she has to go back to work. That's what the doctor's version of the situation is. It's what her version is. So that's different. And you have to ask yourself, why? Why is the doctor not agreeing with Lindsay Clancy's understanding of her own condition?
Is that it? Is that what you noted in the records?
Well, those were her words when asked, what are the problems for which you are seeking help?
I see. Postpartum anxiety. Now, as a psychiatrist, meeting with this young woman after a month or so of working as a psychiatrist for Astor, there are tests that you administer to a woman who's in postpartum to find out what type of anxiety they have, right?
Well, there are some screening tests, but the most important thing is what the patient tells you and what my assessment is in the session.
I see. And that would carry through the Tufts evaluations for all 14 of those meetings, is what the patient tells you, right?
Yes, and what I observe in the session.
14 meetings.
Through the computer.
What, if you can tell me, is the
14 meetings. I mean, that's insane. I didn't realize until he said 14 meetings that they had met that frequently in such a short period of time. What does that tell you? That's unheard of in psychiatry. It tells you a number of things. Number one, Lindsay may not have been so compliant. Wink, wink. Obviously, we know that because they kept changing medicines. Number two, her symptoms had to be pretty severe for a psychiatrist to be so concerned enough. Psychiatrists typically, guys, once somebody has gotten to their, the right medicine, they will often not see a patient but once a month for 20 minutes. Now, in the beginning, they might see them once a week, or maybe like even twice a week in the very, very, very beginning for the first couple of weeks at most, because they're in the midst of a medication change and they know it's important. They want to have eyes on them, right? And of course, you insist that they are working with a therapist. And of course, you're supposed to be communicating with the therapist, which obviously Dr. Tufts isn't doing. So this is a lot of meetings. So what does that tell you? It tells you that she must have been concerned enough to be meeting with her that many times. Either that, or Lindsay was concerned enough to be continually scheduling meetings with her.
Edinburgh test.
It is a scale that looks at symptoms of postpartum depression.
And when you administer, that's a major test, isn't it, for a doctor to evaluate a patient for PPD?
I wouldn't say it's a major test.
It's a pretty big one, though, isn't it? It's the only one that measures the postpartum depression, right?
It's a common one.
It's a what?
Commonly used.
Commonly. All right, so when you used it on Lindsay, when was that administered to her?
I did not use it on Lindsay.
Why?
All right, so just to, I don't want to beat a dead horse, so to speak, but here, Reddington is making a big deal about the fact that she did not use the Edinburgh assessment. Instead, she used the patient health questionnaire. I actually looked into this. There is very little difference in terms of the research on which of these two questionnaires you use. They're both legitimate in recognizing postpartum depression. In other words, if somebody is depressed, whether it's postpartum or not, this form is just as good as the Edinburgh scale at addressing it as at catching it is a better way to say it. But yes, it is not specific to postpartum. At Love Knows No Words, happy 1 month anniversary. Do you know about what percentage of psychiatrists complete a fellowship in a subspecialty, including in women's reproductive health? Well, it's a little odd because all of them, like psychiatry is the specialty. So that's the first thing that they're specializing in. And then I think there may be quite a few, like, for example, I've known psychiatrists that specialized in like emergency room or more severe psychiatric situations, others that have specialized in substance use disorders. I've never heard of it, though. I think she did say that it was for a pretty short period of time. I can't remember exactly what she told us. She told us that it was like a few days a week for like a few months or something. It was a very, very short period of time, which that I have never heard of. Typically, in my experience, you're in a subspecialty for like a year. So, I don't. She also was doing this during COVID, and I do suspect that being a resident during COVID probably did have some impact. You remember those first couple of years of COVID at the very, very beginning. I don't know, things were shut down, but also everything was repositioning itself, particularly in our field, because we all had to scramble to figure out how to use Zoom and the whole thing. So I imagine that did have an effect, even though she's trying to pretend like it didn't. But I think that they all do some area of specialty, even within psychiatry. So I think it's actually quite common. I think you have to, and it's my understanding.
We use the PHQ-9, which is
PHQ-9?
It's a depression screening form.
That's like generalized anxiety disorder, general depression. It's got nothing to do with a woman suffering from postpartum depression, does it?
I disagree.
Well, do you agree that people perhaps that may know a little more than you determine that the Edinburgh scale is the appropriate scale to administer to a pregnant or postpartum woman?
Sustained as a form.
You're familiar with the Edinburgh scale, right?
I've heard of it.
And can you explain to me how it's graded?
No, I cannot.
Is when a patient presents with an incongruent, something like that, appearance perhaps, that would mean that they're saying, I'm okay, but they don't look like they're okay, right?
Well, it could. I don't think her affect and her mood were really that incongruent at that time. I think that she didn't appear terribly depressed. I didn't say she was terribly depressed in that initial visit, but she said she was anxious and she appeared anxious. That's pretty congruent.
Okay. So did you put in the report that she was congruent or incongruent?
So that is not an option for me to indicate in that section, but it was congruent.
You're like a robot. You can't take a pen and write something down. You have to do the drop box and the X's on the computer?
Well, if it's on the computer.
And let me tell you this. I will say that one of the things that is like every clinician's nightmare is the fact that we have to do so much paperwork. So programs try to make it as automated as they can to try to make it as easy as possible so that we don't have to spend hours every day doing all this clinical paperwork. That's why there's all the little boxes, right? That's why some of the forms are kind of like auto populating, because all of these programs try to make filling out clinical notes as easy as possible. Here's the problem. Something, God forbid, like this happens to you, in your office, around you, anywhere near you. And all of a sudden, those clinical notes, man, they take on a completely different meaning. Their weight is like as substantive as could possibly be. And this situation certainly had me thinking, oh man, we really better get a lot more serious about clinical notes. Not me personally, but all of us as a field. Because this might be the 1 in a trillion, situation where this kind of thing happens. But it is so horrific and so serious that it's like, well, yeah, tough. We got to figure out how to make sure that these notes are as accurate and as up to speed as possible, just in case, even if it is a 1 in, however many thousand chance of something this horrific happening.
I'm limited by the options that are out there.
You're a doctor. Why are you limited?
Because of the technology.
What technology? The fact that there's a form on a computer? You're trying to treat a human being who comes to you for help.
And that's what's most important. What's most important was the treatment, not what is checked off on a box.
Makes sense. So you were unable to make a note as to whether or not her affect and her mood appeared to be in conflict, and that she would have been incongruent, and that she had poor insight. You couldn't write that down. Is that right? Because the box doesn't let you.
Correct.
So basically, she's telling you that, okay, well, actually, when she came, do you know that she never saw, other than when she was in nursing school, would surprise you, a psychiatrist? And that was only for like a week when she got the Prozac in nursing school because she was afraid of public speaking? Did you know that?
I was aware that she did not have a significant past psychiatric history. I was aware.
So, a couple of important things. As I already said, no prior mental health history might be important for Reddington to point out because his experts are undoubtedly going to come on the witness stand and tell us all about postpartum psychosis. And like I already said, 50% of folks who go on to have it do not have a prior mental health history. I do suspect, however, as I'm getting to know who Lindsay Clancy is a little bit more, starting to understand that has maybe a more of an anxious personality at baseline. And we will talk more about that as we go along. But one of the clues, because I'm trying to like put any little clue or little puzzle piece that I get, I'm putting it into my brain and trying to fit it somewhere where it makes sense. And I hear fear of public speaking. Now I hear that and I add that with everything else that we're learning about Lindsay. And it's starting to really amount to somebody who was not comfortable speaking honestly about her feelings and even her thoughts to anyone. She just was not comfortable being completely honest. Now, some people are an open book. They'll come into your office and they'll just start telling you everything that you could ever even think to ask. Other people are just really uncomfortable. I'm sure I would be too, walking into a psychiatrist's office. I probably would take some pulling out of me to get me to start just blabbing away. And I suspect this is an important part of the story, that Lindsay Clancy was not comfortable telling this psychiatrist or any of these medical professionals the full extent of what she was experiencing. I think that's part of why he's bringing up the fear of public speaking.
Okay, so you were the first psychiatrist that she had the pleasure of meeting. Is that correct?
I think it was.
And isn't that important for you as a doctor to take a history?
I did take a history.
So can you tell us? You're testifying here for the government. Tell us whether or not she had any past psychiatric history other than in nursing school for a week for the Prozac.
She did not report any other past psychiatric history other than the Prozac and Wellbutrin.
So when a patient comes to see you and you're treating to help that patient, if they don't report something to you, you don't know about it apparently, right?
Well, I think it depends. There are certainly things I can assess, but if it's related to their history, I do need them to tell me.
Well, you can't assess it unless you ask, right?
Unless I ask, or they volunteer it, or they fill it out.
Of course, we already talked about the volunteering. How about you as a doctor, when you're evaluating a patient coming to you for help, do you ask them questions?
Yes.
Basically, other than hoping to give her hope, is what you said, for the therapy. How do you give someone hope for therapy, the other doctor?
Try to encourage them. And
what did you encourage her on September 15th?
Sorry?
What did you encourage her to give her hope on September 15th?
What did I encourage her?
Yeah.
I don't remember exactly the words. It was almost 4 years ago. No, we don't write those details of everything
that's the
that's
therapy
said.
you're talking about, right? Yes.
Yes.
And you don't write down the therapy you give the patient in the records, right?
Well, I write something about it. I mentioned that.
Hold on.
So yes or no?
Hold on. You let her finish the question. You can listen to the question and answer just what they asked. Okay? Go ahead. You can rephrase that question, Counsel.
No, let her answer.
All right.
I mentioned that I provided supportive therapy.
What is supportive therapy?
It's listening to the patient's concerns and providing emotional support and validation.
So,
do you know, before this trial, I had never heard the phrase supportive therapy. I had no idea what that means, but apparently this is what psychiatrists do when they talk about therapy. I guess that's what it's called, supportive therapy. In other words, when you are billing, so when a person has to bill their insurance company for their psychiatric care, the appointment has to be broken down into like what percentage was like medical or talking about medicine and what percentage was therapeutic. And I guess that part is sort of supportive therapy. That's like what it's referred to as, which is just listening and validating, apparently, according to Dr. Tufts. So I'd never heard that phrase before, though. Not in this context, not at all.
Emotional support and validation all sounds good. Here's a young woman who was what, 20, 29, 30 years old, came to see you?
Yes.
And you for help, right?
Yes.
Told you she couldn't sleep and she was anxious, correct?
Yes.
You know that she was postpartum, correct?
Yes.
You know that as a patient who was postpartum. By the way, what is your opinion of the period of postpartum wherein one can have postpartum depression and, more importantly, postpartum psychosis? What's the time frame?
It's typically 1 year.
So she was well within that time frame, correct?
Yes.
And you tried to provide therapy by giving her hope. And how long do you figure did that take? 5 minutes, 10 minutes, 2 minutes?
I'm not sure. I think it was different in each session.
Okay. So the only thing that you diagnosed Lindsay with on September 15th was GAD, generalized anxiety disorder, correct?
It was generalized anxiety disorder as well as an adjustment disorder with depressed mood.
Right. So the generalized anxiety disorder. So again, for whatever reason, we are not hearing from this doctor about postpartum. And, you know, I would just love for somebody to say a couple of questions if I could get this woman on the phone. That would be one. Why didn't you consider her anxiety as being within the postpartum period? There's a reason, without a doubt, there's a reason. Whether the reason is because insurance, you know, makes me do more work if I do that, to some clinical reason. But that's a very important question. The other question I would have for her is, what is your interpretation of what has happened here? You're the one that apparently knows Lindsay Clancy the best, having treated her 14 times in, 4 months. What do you think happened in hindsight? Now, obviously, they're not going to ask that because legally that could go awry very easily. But I would love to hear, as the treating psychiatrist, in retrospect, who, by the way, believes Lindsay was being honest with her. So if she believes that Lindsay was being honest with her about her condition, about the medicine she was or wasn't taking, about the severity of her symptoms, then what other conclusion could we possibly come to other than this good doctor believes that she had a psychotic episode? What alternative could this doctor, if we are, if we go down the logic tree direction, if we start moving in that direction, what other conclusion could you come to that is reasonable besides she was losing her mind? And in psychiatry, losing one's mind is called psychosis. That's what it's called. So I just don't know what other terminology we would see from the good doctor here. At Osage County Jungle sends 200 jewels and sunshine. I love your cats. They are so beautiful. And is a member for 9 months. Says, county in Oklahoma, jungle because I have many animals. I hope you had an amazing vacation. So happy to have you back. So happy to be back. I missed you guys. See how hard it was for me to stay away. I couldn't even do it. I was at the beach and I'm talking to you guys. You see how good I am at vacation. Not so good at it. But I know this is going to sound so corny, but I do feel like so lucky that I get to do this. It does kind of feel like every day is a little bit like a vacation for me, as hokey as that sounds, I know. But I love talking to you guys. It's what I love to do. So very lucky to be able to do it. And Madeira Beach caregiver. Hi, dear. How are you? Sends $2. SM our congratulations in order? SSM, our congratulations order. Sam, what are we talking about? I don't know. I don't think so. Could be a number of different things. So I don't know what you're asking about exactly. But I will say the one sort of new development that is exciting is that I do have a dissertation committee forming. I need one more person, but I do have that committee. It's moving. I have a topic, and I can't tell you guys what it is exactly, but I can only tell you that it is very much in the deception detection realm. So you can imagine that I am beside myself excited about it. So excited. I never thought I'd be this excited about a dissertation, but I really am. I really am that excited about it. So I'm a nerd for
You
sure.
prescribed medications to her, right? Yes. And the medication that you provided to her was the sertraline, right? Yes. Tell me about bipolar. What's bipolar?
Bipolar is a mood disorder that has both depressive episodes as well as episodes of mania.
And is it your understanding that if a person has a difficult birth and in fact has some psychiatric attributes as a result of that difficult birth, that you should not prescribe SSRIs to that person because they could be bipolar?
Having a difficult birth does not, it's not a contraindication to an SSRI.
So after she had her second child, she took Zoloft, and you did not detail any side effects, and you don't remember any side effects. Do you agree that Lindsay had, at this point, a history of mental problems during postpartum?
She had a history of anxiety postpartum.
Anxiety to the point that she
And depression.
was prescribed an SSRI?
Yes.
And depression, right? She was actually, at least from Lindsay's self-report, it sounded like she was actually prescribed medication because she was experiencing postpartum depression after Dawson.
And she also had mental problems when she came to see you, right?
Yes.
So she had mental problems after she had the second child, mental problems after she had the third child, correct?
Yes.
And you'd agree with me that this is not easy stuff for somebody to be talking about. People get embarrassed in our society if they had mental problems, don't they?
Some do.
She did, didn't she?
I'm not sure.
So
I'm not sure. Let's think about that for a second, right? This is what I mean about stuff can just kind of fly past that seems so irrelevant. You are a psychiatrist who's alleging that you use the word therapy. I know that it's not legitimate, but at least you're pretending like it is. So let's just pretend along with you. How could you possibly not know the answer to that question? And it seems so stupid. But you worked with this woman 14 times. You don't know whether or not you think she would be embarrassed about having mental health issues? How do you not know that? She knows that. How do you not know that? I mean, everything that we're learning about Lindsay is that she's more on the careful, cautious, guarded, people pleasing. People pleasing is like the central character feature that we're getting from everybody. That she shows up and says all the right things, right? Well, we're even hearing from her that she has poor insight. So she's aware of the fact on some level that Lindsay shows up differently than she is. Something is off. And to me, this people pleasing is really significant because the kind of people pleasing, so the DA is making it sound like the people pleasing is about control, like some evil trait. But when you consider the anxiety, the way that she is trying to control the medications, the way she's making one decision 1 second, another decision the next second, the level of anxiety that we are talking about is so extreme. I mean, she's scoring the highest you can on these generalized anxiety instruments that are being administered. the highest you can, like 100% on these anxiety measures. I mean, that's extreme, 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 right? How else do you say it? It's so extreme. And what it says to me when somebody's people pleasing and their anxiety is that bad is that they lack what's called ego strength. It means that they almost don't trust themselves, that they are switching how they show up depending on who they're talking to, that it's very difficult to make a steadfast decision because if I'm always changing my thinking depending on who's in front of me, then I'm going to be pretty messed up a lot of the time. And it sounds like that's what was happening here. Whoever was in front of her, she was sort of agreeing with whatever they were saying. And that's what happens when we begin to lose our own sense of self. Because think about it. What do we use to make decisions if not our own sense? Who we are, what our values are, what our beliefs are. If I'm not sure about all those things, then what am I going to be using to make a decision? For example, what medicine to take, what medicine not to take, what intervention to pursue, what therapist to go see, what type of therapy, should I go to a therapist at all? All of that is going to be informed by who I believe I am. And if I'm losing touch with that, then it makes sense why she's going around doctors, she's starting a medication and then stopping. She's changing her mind about what medicine she wants to take or doesn't want to take. And that's how we wound up with all these prescriptions. It's not malicious. It's not drug seeking. It's a person who's lost their sense of self, who's shifting depending on who's in front of her, because sort of people pleasing is like the driving force in these moments when she's showing up in front of these providers. So she's kind of yeah-yang them to death. And it's tragic. I mean, what the good doctor seems to just not be able to see, or at least is pretending that she didn't see, because I believe she did see it and she's pretending she didn't see it. This anxiety is so extreme, it's teetering on delusional. We're trending in the direction of delusion. And I've seen that. I've seen anxiety to where reality becomes blurred. And I think that's what we're seeing with Lindsay. We're watching it happen as we go through these clinical notes with this Dr. Tusk.
Not documenting any of the side effects. Did you think it would be important to document the side effects of the drug before you prescribed Zoloft a second time? She told me that she had. You don't know, but she had side effects with Zoloft. Was it important for you to document the second time that you're giving a Zoloft?
I did not feel that it was necessary to document the specific side effects. It's a phone number that patients in crisis can call and speak to a trained counselor.
Now, a psychiatrist, you'd agree with me, is not a counselor, that's for sure, right?
Well, a psychiatrist has training in therapy as well as in medicine.
Did you give Lindsay Clancy any therapy?
There was some therapy incorporated in our sessions,
like
but
what?
we did.
Like what?
Providing emotional support, listening to her.
Hold on, everybody.
It's funny.
You ask the question, I'm going to let her finish, and then you can follow up with any questions you want. Go ahead, Doc.
Anything else you want to say?
So her sessions were largely focused on the medication management, but there was an aspect of therapy including those items.
Okay, and the sessions were for what, 17 minutes?
Oh, God.
How long were they?
So bad.
25 to 30 minutes.
So 25 to 30 minutes on the television, and will you face the TV screen with her for the full 25 minutes?
Yes.
And that's not noted in your records. It says 17 minutes in all your records, doesn't it?
So if you look closely, it says the therapy component was for 17 minutes. If you look closely, it says the therapy component was was for 17 minutes. It doesn't say the entire duration is 17 minutes.
So what do you do? When you try to
What do you do?
As a psychiatrist to a patient that came to see you, what do you do? What do you do with therapy?
It depends on the person.
Well, how about Lindsay Clancy? What did you do for therapy with her?
I listened to her. I listened to her concerns and provided support. I tried to provide her with hope that eventually things would improve.
So you listened to her, you listened to her concerns, and you'd agree with me that her concerns were, for example, that she actually was unable to sleep. It's one of her concerns, right?
She was having a lot of difficulty with sleep.
Someone comes to you as a person who is in postpartum and is all the symptomology that she had related to you, that if she told you that she was on Zoloft after her second child and had side effects, you don't think it's important to document the side effects, number one, right?
It depends what the side effects are.
Which we don't know because you didn't write them down, you don't remember it.
I would have written them down. If
No, not what you would have done. What did you do? No, go ahead.
I would have written them down.
What did you do?
I wrote that she had side effects.
What are they?
I'm not sure.
And then you prescribed Zoloft again, didn't you, in 2022?
Yes.
Do you recall?
So I didn't realize that. I don't know if other people realize that Lindsay had told her that she had had side effects from taking Zoloft, and then she decided to prescribe it again. Now, I don't know how significant that is, and that's another conversation that obviously I see people having and that we have to at least touch on, which is all of these medications. Now, the prosecution is trying to make the argument that these are low doses of pretty benign medicines. That's the argument, that she's not taking them for very long, she's not taking them in high doses, and that because of that, it doesn't matter, right? Now, already, the prosecution's theory about her non-compliance with medicine, I think, has been sufficiently debunked. In my opinion, we've seen the exact opposite. We've seen her be almost vigilant once she's taking the medication. The only problem is she is so scared. She's so, conflicted about taking the medicines that it's not that she wants to be non-compliant with the doctors. It's that she's terrified whether to take it or not. And again, this is what I was saying about not having any strength of character. If I can't trust myself and I don't trust anybody else, then my decision making is going to be impaired. I'm going to constantly be changing my mind about what intervention to pursue. And I think that's what we saw here. We saw a woman who pursued one thing, was very conflicted, whether it was because it was called an antipsychotic, whether it was because she thought it eventually could be habit forming, whether it was because, she had some side effects or was sensitive to side effects, or all of those reasons, she kept changing her mind. But then you also, as you guys are pointing out in the chat, you have to consider the reality of the fact that this is a woman who's already unstable, who's already reporting the highest, most maximum level of anxiety that is measurable by psychological instruments. Max, highest level. Extremely depressed. At least that's what she's reporting, and we'll get to that more. So this is someone who's clearly not well. And then you're adding the shifting in meds. It's almost at this point like not even as important what the medicine is as it is the fact that it keeps changing. You can't just keep changing medicine like this and expect it to be like completely irrelevant. It's not Tic Tacs. It's medicine. And again, the prosecution just keeps playing it off. And the other thing that we're not hearing anything at all about is the combinations of medicines. Like everybody so far, including Reddington, is sort of talking about the medications in isolation of each other. So it's like, oh, it was just, 10 milligrams of this or 25 milligrams of this and 100 milligrams of Seroquel, whatever. But these things are not in isolation, right? Because she's being told to take it every day, not take it every day. She's sometimes taking it PRN, other times taking it with hydroxyzine or with Benadryl. So it's impossible to track this. I mean, essentially what's happening is a woman who's decompensating is now taking medication that's facilitating the decompensation, is just making the whole situation worse. It's almost like the medications that she's taking are exacerbating what she was already experiencing, which was some level of extreme anxiety, or what you might say, arguably, was on the mania symptom list, and then severe depression. Well, that's exactly what's happening with these medicines, right? I don't know how they missed it, but they missed it. And it's a very, very big miss. It was a very big miss for these doctors. Big time miss, guys. Big time. At Mark, hi Mark. Happy 8-month anniversary. Where did I go on vacation? I was all over the place. So I was down the shore, went to the beach for a while. I was up in Connecticut. I was in Massachusetts. Then I was at Foxborough for a couple of days because my daughter loves Korean boy bands. And so we were at BTS, which is really interesting. I'm very grateful, by the way, that my 12-year-old loves K-pop. It's like the greatest thing in the whole world. If you're lucky enough to have a, preteen and they have to be obsessed with something, pray it's K-pop, because they're like the nicest people. Normally you go to a concert that is jam-packed. I mean, this thing was sold out. This concert was sold out on Ticketmaster within hours. I've never seen that, by the way. It's very unusual. This is like the world's most, biggest band. And you did not see or smell marijuana or people vaping. There was no substances of abuse other than alcohol, of course, being consumed anywhere in the entire stadium. I smell marijuana more walking down my block than, I didn't even smell it in the entire stadium. It's crazy. It's like the just nicest people. Everyone's brings all this beaded jewelry to give away, stickers to give out to each other. It's like the nicest group of people, all ages. So very lucky. So that's what I was doing. It was like lots of family, but it was super fun. It was really, really fun. I was very, very lucky to get to spend time with my family, with my daughter, with my fiance, with my mom, with my sister and my nieces, my mom's boyfriend. So it was lots of fun. Hi, your dad's favorite mom. Sends 199. It was a clinical rotation. Oh, I didn't hear that. Very helpful. So the time that she spent in the postpartum part of her residency, it was a rotation in her residency. And like I said, I think it was affected perhaps by COVID because of the way she was describing how it was organized. It was like a couple days a week or something. And then she said she kept the clients for a while. Hard to know because, like I said, she's not being an entirely transparent reporter as we go through this, because she's got to save her own tush, which, I get it, I guess, right? I get it. I got to know it since $5. RN ICU, 42 years. I think that says 42 years. There's a little line in the way, so I apologize if I don't get it right. Spouse S in 96. Oh my God. Okay, let me read this again. I got to know it. RN ICU, 42 years. Spouse S in 96. I'm so sorry. Sought therapy, me and the kids. Care is poor. IMHO. This medical doctor presents poorly. That matters. Yeah, I know. It does. My deepest sympathies to you. I can't even imagine how difficult that situation could be. Unbelievable. There's a lot of very poor mental health care out there. There really is. I mean, and I know that unfortunately because of my clients who have experienced it. I have this one client, and it's a joke between us. We have been through, I can't even count now how many psychiatrists we've been through together. Now, I will say, to be fair to the practice of psychiatry, this situation is extremely complicated. It's not an easy situation. It's a very complicated situation. But we can't get them on the phone. Like, I have to call these psychiatric providers like every other day for weeks to get them to eventually call me back or even just leave me a message or shoot me a text. It's insane. And I know that's not everybody. I want to be clear. I'm not saying that that's everybody. But I guess with any profession, there's people that are not great at it. This woman was she was very young. She was very young. And like I said, humans just don't fit into nice little boxes like the way we want them to. They just don't. It takes a lot of time and experience to learn. I started to tell this story the other day and then I got distracted, but I worked with one person for 11 years and it took me, I want to say 7 or 8 years to figure out what the diagnosis was because it turned out that the diagnosis was not even in the DSM. And he had been given every diagnosis you could think of. If you could think of it, he had been given it and they were all incorrect. And then it took years of me sitting in the room going, what is going on here? What is going on here? What could this be? What could this be? What could be going on here? What could be going on here? And we eventually figured it out, but it took a very, very long time. Sometimes mental health, it's just not easy. People are complicated. And things just like they don't fit into nice boxes. I don't know. It's a shame. It's a shame. It really, really is. Really is. So sorry to hear that. I gotta know it. But, you must be one tough cookie, though. That's for sure. That is for sure.
In the period of September of 22, October of 22, into November of 22, that she used the word overwhelmed, told you that she was overwhelmed. Is that correct?
Sorry, which visit are we looking at?
Well, the period of time, September, October, November, she used the terminology that she was overwhelmed.
Yes.
Okay. And when you were treating her, you didn't think that she was just merely overwhelmed with 3 children. You knew she was really struggling, didn't you?
I did.
And it was at that point that you diagnosed her with a psychiatric condition. And you prescribed psychiatric meds. Isn't that right?
I prescribed psychiatric medications, yes.
So when you prescribed the Zoloft and told her to increase it, she told you that she was having all these difficulties. You told her to stop.
That's very funny. Melissa Chin writes, starting your career like Dr. Tubbs is enough to make you rethink your career path. I had the exact same thought today about Dr. Tubbs. I was like, oh yeah, this is enough to make you rethink your career path without a doubt. I imagine that we will eventually learn Dr. Tubbs is working in a different field. Probably sooner rather than later. For sure.
Did you give her therapy when you saw her?
Without a doubt.
Yes.
What did you do?
I think that I provided
I
reassurance.
apologize, but not what you think. I want to know what you did. And that's why you write stuff down. So take your time to look at your notes. What did you do with this young woman for therapy?
On which day?
On what?
Which day are we talking about specifically?
When she came to you and told you that she was overwhelmed, and you diagnosed her with a mental illness and prescribed a psychiatric condition, the psychiatric meds. What therapy did you give it? Because you told us that when you're on the television, you still give them therapy too, right?
I do.
What did you do?
It's so
well,
funny.
I'm having trouble identifying exactly when she said the words overwhelmed.
Okay.
So it's hard to pinpoint exactly what I said in a span of, a number of different visits.
Did you indicate that there's information on the website that if a person has an emergency that they should do something?
I did, and I advised her the same.
So basically, if one of your patients becomes suicidal, and on that note, did she tell you at that point, up to November of 22, that she was dwelling on suicidal thoughts?
It was a while before she mentioned anything about suicidal thoughts.
Tell us when.
I might need to look through the records to see when.
That's exactly right, Iron Chef. Yeah, she just comes off as not being that concerned. And it seems like not only her, but none of them are taking accountability. Now, I bet if I had to put money on it, my bet would be that inside, if we were to speak to her as a friend, she's probably aware that she missed it. Because again, remember, this woman allegedly had an interest or put forth that she had some expertise or knowledge about postpartum mental health. If that's true, I don't know how you could have missed this. Now, okay, maybe you could argue that she wasn't evidencing psychosis, particularly from her view, because she's talking about how depressed she was. Although I think there's plenty here to argue that there's evidence of mania or hypomania. But putting that aside, let's just pretend there was no hypomania, no reason to even suspect psychotic symptoms. The depression was getting so severe. I mean, Lindsay is reporting serious depression, severe depression. She missed it. I mean, that's what I believe she must know that she missed it. That is my personal belief, that she knows it. She'll never admit it, but knows that she missed it. This was a monumental, astronomical screw up. An astronomical screw up. An astronomical screw up. At Green Eyed Lady asks, why is Zoloft pushed so heavily? It's a great question. I think because they say it's a first line defense for a person who suffers from both depression and anxiety. So I think they think of it as like kind of killing two birds, right, with one stone. The irony about that, though, is, most of the time the two come together, whether people report it or not. But I think that's why it's prescribed so heavily, because, it's like one of the drugs that they teach you in medical school is your first line of defense when somebody reports experiencing symptoms of depression and anxiety. That's my guess. Particularly, by the way, in somebody who does not have a history with psychiatric issues. So, for example, if you're somebody who's anxious about going back to work, then, I know Zoloft would be a great idea for, 6 months, that kind of thing. Pretty low side effect profile for most people. I think that's the way psychiatrists look at it. But the other thing you need to know is every psychiatrist has a different kind of protocol or list of drugs that they prefer. So I haven't really worked with a ton of folks that are Zoloft heavy, at least not any more than any of the other antidepressants. So I think it probably depends, but that's why it's just in the books. It's like, you open up the book and it's one of the first line defense drugs.
She first did. December 1st.
So on December 1st, what did she tell you?
That she denied feeling suicidal, but that she was close to feeling suicidal.
All right. So this to me is a colossal screw up. It's a colossal screw up, you guys. Colossal screw up. You tell me how somebody is close to feeling suicidal. Just think about that phrase. Now, the doctor here tries to argue on redirect that, oh, well, if somebody's saying they're close to being something, then that technically means they're not there yet. And she was focusing on the not there yet. But if we start taking all the pieces of the puzzle and putting them together, and we consider Lindsay Clancy's personality, the fact that she has poor insight about her symptoms, which is what the good doctor told us already, the fact that she's also in the field and probably feels pretty embarrassed, given that she's a labor and delivery nurse specifically. So if somebody like Lindsay Clancy, based on everything we have learned about her, comes to you and says, I'm close to having suicidal ideation, that to me is a screaming red flag that screams, and I mean screams, suicidal ideation, because she's not able to say it outright. She's not, it's like saying, I have a friend who's, hey, I heard our friend called me up, and do you have any advice for somebody? You know, that kind of thing. That's who we are learning Lindsay Clancy is or was. She just wasn't going to be honest with herself, guys, herself, not with these people, with herself about the reality of the situation. And I will tell you, listening to other women who have had very similar situations, they report the exact same thing. Not being willing to be honest with themselves about what they're going through, largely because of the shame, the guilt that they're experiencing about the thoughts in their head. They don't want to tell anybody else. And this is a medical doctor. She is a mandated reporter. If you say out loud to this woman, I'm having thoughts of ending my life or my children's lives, you're going to be in the hospital and they might be taken away from you. So it makes perfect sense, if you're using your brain, why somebody like Lindsay wouldn't have said that, but would rather have said, I'm very close. I mean, think about that. If somebody says to you, I'm very close, you know what I'm like? Where else is there to go from here? Where else are we going? If somebody's very close to wanting to end their life, the only other place to go is the end, right? There's only one place to go down. That's, I'm at the end now. She missed it. She missed it. That's what I see. She missed
It's
it.
kind of like being a fisherman out in the ocean who's worried about the possibility of a storm and is thinking about the storm and is dwelling on the storm. You're almost in fear of the storm, right?
Objection.
No.
Is it?
I guess. She denied having suicidal thoughts, but felt that she was getting close to it.
Okay. So she was dwelling on it or thinking about it, right? Is that fair?
She was fearful of eventually having those kinds of thoughts.
Absolutely. At Scorpio Girl 1101 says, we need to change the stigma. Mothers should be able to tell the truth without fearing their children being taken away from them. Yeah. And I noticed that in Europe, particularly in Great Britain, there appears to be a greater awareness about postpartum mental health. and programs where the moms and their babies move in for months. They move in, and we'll see some of it. We're going to get to see some of it. Now, I think the program that Lindsay was in, where the nurse whose name I just forgot, what's her name? The lady we heard from today who wound up leaving the practice and turned her over to a different therapist to work with. I don't know why I just forgot her name. Julie Paul, Nurse Paul. She's a psychiatric nurse practitioner. I think she was trying to pilot a similar type of idea in what she was doing, but not to the same extreme where the mothers go in with the babies. So I'm not sure if that was the program that Lindsay went to for a day. It could have been. I don't know why, and I'd love to know why. And I don't think we've heard yet why Lindsay was not considered appropriate or decided she wasn't appropriate for that program. Now, the way that it was painted to us, had something to do with the medications that she was taking. That was why she couldn't be in the mothers and babies program. But I don't believe anything that I don't believe anything that we're hearing without hearing it directly from the horse's mouth in this case yet, because I just don't know. I don't know, and it doesn't sound right to me. It doesn't sound right to me that she would not have been allowed into that program because of whatever medicine that she had just started taking for like a week. It just didn't make any sense. So I'm not sure what was really going on there. But I agree with you wholeheartedly. I think you are 100% right. We need to allow mothers to tell the truth about what they're feeling. It's like enough already with this. How bad does it have to get before we learn something?
Would you agree with me that many times patients, especially psychiatric patients, minimize their symptomology?
Patients sometimes do.
And sometimes when a woman has just had a child and has other little kids at home, that they're worried about the government taking kids away from them because you're a mandated reporter, aren't you?
Mm-hmm.
You're a mandated reporter, aren't you?
I am.
And if she told you, I'm having suicidal thoughts, I'm close to it, homicidal thoughts, you'd report that, wouldn't you?
Not necessarily. I think it really depends on the context, but having suicidal thoughts alone is not a reportable condition.
All right. So basically, we know that she was close to having suicidal thoughts to kill herself, whatever that means. We don't know how frequently she was having them. Yeah?
Today, I don't know how frequently, but at that point, I believe I did know how frequently they were.
Oh, okay. So as a result of that, you then gave her therapy, I imagine, right? Through the television.
Yes.
Through the
And
television.
what therapy did you give her in November of 22?
I gave her supportive psychotherapy.
How about Lindsay?
I love when
I
he
don't
says that.
remember the
It's too
exact
funny.
therapeutic words that I used.
Okay. How long did you give the therapy? Validation and all that stuff.
I don't remember exactly the duration.
About 10 minutes?
Maybe.
Through the television, right?
Through the computer.
Yes,
Yeah, I mean, so the huge problem here, I think it's hilarious that Reddington keeps making a big deal about it being through the television. In my experience, that is really not that significant of a factor. But the time is the significant factor because you just simply cannot know anything about, well, not anything. I shouldn't say anything. You just really can't know anything substantial about somebody in 10 minutes. You have to spend time with someone to get to know them, to learn about them, to begin to put all the pieces together about who they are, about what they're about, but what they want to do with you, what the work is, why are they here, what's really going on, how am I going to help this person best. I can't even imagine the idea of doing that in 17 minutes. The idea of doing that in 17 minutes is so unimaginable. It's not even possible. And that has a lot to do with just the way that the insurance company has set up psychiatry, because that's what they'll pay for. They just won't pay for full sessions, full hour-long psychiatric sessions. They will pay for that, I believe, during the intake assessment period, however long you want that to be or that winds up being. But it really is designed the way Dr. Tufts was talking about it. In these programs, like the one she was working at the time, there is a psychiatrist or a team of psychiatrists on the staff. And then there's social workers or clinical psychologists or clinicians, mental health counselors, whatever, who are really doing the therapy. And the idea is to work together as a team, to communicate every step of the way. And I have to believe that this woman's, Lindsay Clancy's, symptoms are so severe that you would be communicating with the team. I mean, that somebody would be pointing it out, like, hello, what are we doing about Lindsay? But there's no notes about that. And there would be notes in the record that said, at our treatment team meeting, we collaborated for Lindsay Clancy's care. I sat down with her therapist, who she met with twice, I guess. But even though they only met twice, the fact that they met twice, Dr. Tufts should have been communicating with that person. And as far as we know, there was no record of that, at least not that we've seen, or not that I've seen anyway. So yeah, of course you should be communicating. This is a seriously mentally ill person. If I were Dr. Tufts, I would have been loving the idea of calling up the other providers, because this is a very serious situation and you got to have some intuition. This is not going well. Things are not going well. This woman's not following my instruction. That's the other thing. She's not doing what Dr. Tufts is telling her to do. Like, if you're the doctor and then you find out that she's not doing what I tell her to do, then I find out that she, is going behind my back and starting another therapeutic program. Then I find out that she went behind my back again and checked herself into a psychiatric institution. Like, these are 4 alarm fires in mental health. 4 alarm fires. These are not, this is major, major stuff. And she missed it. She missed it. She missed it. She missed it. And it very well might be because of her lack of experience. It's hard to say, but she missed it. There's no way around it. She missed it, and there was plenty of opportunities for this person to not have missed it. The people at McLean, they screwed up royally, but they only had a few days with Lindsay, right? The woman, Julie Paul, she does very much, as some of you are pointing out, seem on the ball. Unfortunately for Lindsay Clancy, she was only there. She saw her, I think, once for an extensive intake, and then never saw her again because that person left the practice. And the woman, by the way, that she had recommended Lindsay go to after she left the practice, I believe her area of specialization is substance abuse, because I know that they had said that there was 2 parts to their practice. There was the postpartum, and then there was the substance use disorders. The other person who Nurse Paul had said, I think Lindsay should see once I am gone, because she's more experienced. Her background or expertise is in substance use disorders, from what I read about her. I want to say what her name was. There's so many doctors and names in my head that I don't want to say the wrong one and mean the wrong one. So I'll look it up when we take a fervent break in just a minute. At Daddy Delicious sends $4.99. I'm glad you and Mel from Something's Off got to meet over the weekend. Hoping you folks can get together at some point in the future. Absolutely. Mel is so great, right? Just so level. I love that. I love the level-headedness. We absolutely have to. We should have done it a long time ago, to be honest. Just so hard, like we're all so busy and life swirls. But I was really glad to have a chance to meet her. Yeah, it was awesome. Really, really awesome. And thank you for reminding me, because I need to be reminded, you guys. It's just too easy to like let stuff go, you know? Too easy. Okay, let's keep going.
Pointed out,
Almost.
you
We're getting
told
further
people
than I
that
thought
come
we
to see
would.
you, when I say you, I mean collectively Aster Medical, that you would expect that if a person is in crisis, as you guys say, or is suicidal, that they would have to go to a computer or their cell phone, right? They would have to punch in your office, right? Look up the number.
We advise them to call 911 or go to the emergency room as quickly as possible. I don't think I asked her about suicide hotlines.
Would it surprise you to know that she called suicide hotline in that time frame, not once, but twice, and was turned away? You guys were on the front line of this, aren't you?
You missed it.
No.
It does surprise me, yes.
It does what?
It surprises me that she called them twice.
And you never asked her if she had ever called the suicide hotline, did you?
I don't think that I did.
Yeah, I understand. You're a doctor. You were trying to do the right thing. You obviously, this is just horrible, isn't it?
Yeah.
Yes.
She continued on with her treatment with you, correct?
Yes.
Did you also add a drug called hydroxyzine?
Yes.
When was that?
So that was the same visit as an alternative to the Benadryl.
Okay, so on October 26th, when she told you that she was taking over-the-counter Benadryl, I asked you what you prescribed to her, and you said Ativan, right? Right?
Yes.
And then I asked you about the contraindication of Ativan and Benadryl, right?
You asked me about that, yes.
And then you, on October 26th, started her on Buspar, correct?
Mm-hmm. Yes.
And what is the purpose of Buspar? Is that for anxiety?
Yes.
And what kind of drug is Buspar?
It doesn't really fall into a class, but it does act on serotonin.
So it's another, similar to an SSRI, right?
It's kind of like a more mild version of an SSRI.
Okay. So she's on Benadryl over-the-counter, Ativan, which is a benzodiazepine, Buspar, which is an SSRI, and then you prescribe hydroxyzine on the same day, right?
They weren't all to be taken at the same time.
What's hydroxyzine?
Hydroxyzine is an antihistamine.
And as far as you're concerned, she was taking the medications as she was required, right?
That's what I was told.
I'm sorry?
Yes, that's what I was told.
Did you,
But that's not really what she was told, right? Because they talked about her taking was it the initial Zoloft, right? That was the original medicine, even though she had had side effects and taken it in the past. I believe, right? Am I losing it? I believe it was Zoloft. And then she finds out pretty quickly that actually Lindsay didn't start the medicine. So she wasn't being compliant. And that's the thing. This is what I mean by there were pretty serious red flags. If somebody's showing up eager and like they know what they're talking about, like the good nurse that I'm sure Lindsay was, trying to put her best foot forward, but at the same time is reporting these very serious symptoms, anxiety at the highest level that one could experience anxiety, not sleeping for days on end because of when she did start the medication or even prior to starting, struggling with sleep. You know, these are red flags. They're giant red flags. Now, imagine telling somebody who you're legitimately worried is suicidal, here's a number, here's a 1-800 number, just call this if you should continue to struggle. I mean, that's absurd, right? That's how would you? I mean, if somebody is at that level of distress, that they are so distressed and such despair that they are calling a 1-800 S line. I mean, at that point, we're already, like I said, where else is there to go? You don't give out a phone number, a text number, an inter-system chart app to say, hey, if you should continue to struggle, please let me know immediately and then call 911 if I don't answer within 20 minutes, right? Or, but you have a plan. My point is you have a plan. You sit down with that person and you say, here's our plan. Because you want them to know that you are in it with them, that they're not alone. She's talking about wanting to give her patient hope. And then at the same time saying, oh, I told her to call the S hotline if she should continue to struggle. It's like, wait, what? This is insanity. She's not following your instructions. You're saying that she has poor insight about her condition. Her symptoms keep getting worse, or at least are not getting markedly better. Like something is wrong. And you're the doctor. You're it. It's so frustrating. It's so frustrating. 3 babies.
Her.
Yes.
And did you at any
Horrible.
time tell her that she should keep a diary of her medications and keep a diary of any side effects that she has?
I didn't instruct her to do that.
You don't have to instruct somebody to do anything, but did you recommend it? Like say, hey, if you're on all these meds, if you're having an effect, you should write it down. When, time, date, anything like that?
I didn't tell her to do that.
Would that be helpful?
Maybe, but usually we go through all of that in the appointments, and we met very frequently.
Now, those journals are also really helpful where she wrote down the prescription and how much she was taking and what her symptoms were. They were very helpful because they are more evidence of Lindsay's anxiety, how she's spiraling. And you could say, well, that's a good patient thing to do. It is. However, when you start adding up all of the symptoms, what we're learning about her character during this time, her other journal entries where she's talking about her fears, about not worries about the baby sleeping, not being a good enough mom, worrying that, feeling guilty for not spending time with the baby, for spending time with the baby. All of what we're seeing that was going on in her head is very scary stuff. And when you add it all together, it begins to paint a picture of somebody who's pretty hypomanic. Right? So it's like it appears as though, as Dr. Tufts is trying to tell us, well, Lindsay was so depressed. She's reporting she was overwhelmingly depressed. But at the same time, the anxiety is so high, right? The anxiety is at the highest level that you could report being at. And that's pretty discrepant from somebody who's extremely majorly depressed. That's not typically what we see from someone who's majorly depressed to the point of suicide. Somebody who's depressed to the point of suicide does not show up with anxiety at a, 70 on a 70 out of 70 scale. That's not how they show up. They show up as totally depressed, completely depressed, like depressed almost as though they're faking. If you're ever in a room with somebody who's telling you they're depressed and they're so depressed that you think this person is faking or is being dramatic or something like that, let that be an alarm in your head that says, this is a very serious situation. But that's not what this doctor is describing. She's describing somebody with extreme anxiety. And that's, to me, the part that doesn't fit with what other stuff Dr. Tufts is telling us. Like, you keep saying that she's majorly depressed, but then also telling us that she has this extreme at the highest level anxiety. Something is just not, is not right. How else do you say it?
Now, you'd agree with me that at this point, prior to the next appointment, which was November 2nd, she had gotten significantly worse, even after all this medication that you had been prescribing, right? Did you make a note that she was telling you that she had depression and that she was crying, had more anxiety, insomnia had increased, brain fog, and worrying about suicide?
In the couple weeks after starting those medicines, I don't recall that the symptoms were significantly exacerbated.
That's when that you decided to start Zoloft. It says a week ago, right?
That's when the patient started it, yes.
Okay. And she then increased the dose, and it says last night, right?
Yes.
And what was she telling you on the computer screen when you were talking to her? What did she say about increasing?
That's when the patient started it. Lindsay Clancy is sitting in the same room with this woman at this moment. And she just referred to her as the patient. That's when the patient started it. Talk about distancing, right?
The dose of the Zoloft.
That she felt awful. She couldn't sleep. Had insomnia, which became worse when she increased the dose. She didn't want to eat. She was having diarrhea. Food felt really unappealing. She was more depressed on it, crying all day yesterday, which is not normal for her. She had some mental fog and was terrified to start something new.
Okay, so here's what I'm talking about. This is exactly what I mean. We're being told from these symptoms that on one hand, she's depressed to the point of thinking about ending her life, and at the same time experiencing extreme anxiety. Now, I understand that they're arguing these are side effects from the medication. I get that. But we're going to hear the same pattern throughout, very similar, reporting extreme anxiety and then extreme depression. And the level of depression that you would expect to see for somebody to S is not on the same symptom list that you would expect to see anxiety on, unless we're talking about psychosis, not anxiety, unless we're talking about like delusion, right? So, and these are the problems with these words. This doctor keeps referencing anxiety as though it's a broken leg. But anxiety is just a series of symptoms, right? It's just worrying. Well, worrying is also a symptom that you might find with somebody who's psychotic. And she keeps putting it back in the anxiety bucket. And I'm not sure that in this particular case, that's where it should have been. I suspect it is possible that's how she missed it, because she kept putting the anxiety in the anxiety bucket and then separating it from the depression and putting the depression in the depression bucket instead of seeing them as related in some meaningful way. That's what I suspect happened.
Also tell you about her anxiety level.
Anxiety was really bad even before med. Now hard to differentiate. Overnight racing thoughts, paranoid of getting suicidal thoughts, something bad happening, doesn't want to be alone.
Okay, pay close attention to this. Paranoid about something bad happening and doesn't want to be alone. These are the things that you're going to start to hear in a minute from the women who have experienced postpartum psychosis. I mean, to a T. It's very specific. It is not the same. I'm going to say this over and over again. It is not the same as bipolar disorder traditionally presents. It has its own thing. I don't know how else to to frame it, but you're going to see it in just a minute.
That must have given you concern that you got a pretty sick patient on your hands at that point, right?
I was concerned, yes.
So you gave her some therapy, did you?
I gave her some therapy in conjunction with discussing all of her symptoms and assessing her and managing the medication.
Did she tell you that her symptomology at this point on October 20th was so bad that she had to have her mother come and stay with her?
Her mom was coming to provide support, yes.
She wasn't coming to provide support. She was coming to stay with them, to live with them, wasn't she?
Yes, I don't know for how long, but yes.
Did you bother to ask her? Why is her mother having to stay with them?
Because she needed some help.
Do you know how long her mother stayed with her?
I don't.
Do you know that she ended up sleeping in the basement?
I don't.
Do you know that she ended up sleeping with her mother?
I don't.
So you decided that you'd stop the Zoloft and you would monitor closely, right?
Yes.
What does that mean, monitor closely?
Well, I saw her the next day, so that's monitoring, an example of monitoring closely.
On the 20th, you made reference to the fact that you also recommended that she try fish oil and things of that nature, natural remedies.
Yes.
Okay. You also wanted to look into what's called Zulresso, Z-U-L-R-E-S-S-O.
Yes.
What's Zulresso?
It is a treatment for postpartum depression.
So interestingly, Zulresso is a hormone infusion. It's a way to essentially, almost the way that people do, what's the word I'm looking for? What is the type of, like, blood transfusions? But what you're doing is changing, directly affecting the extreme dip in hormone levels that occurs postpartum. So now, again, this is another discrepant piece of information. And it makes you wonder, okay, this must be coming from Lindsay, right? Because this doctor isn't even diagnosing her as having a condition related to postpartum. So is it possible that Lindsay brought the good doctor this medication and asked, hey, what do you think about this? It's my guess about what happened.
And when you say that you were looking into it, what did you do? Did you find out if it was available and if she could participate in the program?
I did some digging online to see where it is done and how to do it. I hadn't officially recommended it, so I had not started that for her. It's not really an easy medicine that I can just start because.
What? I'm sorry.
Sorry, it's not a medication I could start on my own. It is it's infused through an IV in a hospital, so it's a bit difficult to coordinate.
It's a 60-hour infusion.
It's a bit difficult to coordinate, except that she doesn't coordinate anything. There's no coordination of care at all from Dr. Tubbs. Nothing. She doesn't even talk to the people in her own office, apparently.
Right.
It's a long infusion. That sounds right.
And it's about 2.5 days of infusion, and it has to be under hospital circumstance. And the only hospital around here is in Rhode Island, right?
Yes.
And did you ever recommend that she do that?
It was something to consider. I couldn't make the official recommendation because that's not something I prescribe. She ended up actually going to a partial hospitalization program at the hospital that does it. I don't believe the program is completed, but she went, and I advised her to discuss it with them because they have access to that medicine. I don't have access to it.
Of course not. Is this Women and Infants Hospital in Rhode Island that you're talking about?
Okay, so the Women and Infants Hospital in Rhode Island, I believe, is likely a hospital similar or modeled in a similar way to the programs that I was talking about in Great Britain, where women who are experiencing postpartum psychosis can come with their newborns, with their babies, and experience bonding and, get the treatment that they need. And there's any treatment, at least in Great Britain, is made available, including ECT, including this type of hormone replacement, whatever is necessary for that particular patient. I don't know about this Rhode Island hospital, but it sounds like it is probably something similar. And we do not know why it is that Lindsay did not end up, being admitted.
Yes.
So when you looked at the medical records for the Women and Infants Hospital, did they make reference to your inquiry for Zulresso?
I never received records from Women and Infants.
Did you ever look at them, or even online?
Online?
Yeah, like online, like you do when you talk to patients.
No, I never got access to them.
Why?
It's similar to South Shore. It's a completely separate hospital that I don't have access to. I don't work there.
It's just so absurd. This is such absurdity. The fact that this doctor is trying to present herself as though she's never heard of coordinating care with patients is just asinine. I mean, asinine is literally what this is. It's an act, silly, total nonsense. Now, in this case, she didn't know about it, so it would have had to have been the hospital that called her, which is another disgrace. But after she learned about it, it would have been a discussion to have with Lindsay. Like, what is going on, right? What is going on? What do we need to do to get you into the right place? That's not how I would have said it, but you know what I mean, right? How do we help you? Because clearly Lindsay keeps going behind her back to other providers. Why? And she's not inquiring about that. She's not seeing that as a problem. She's not calling the other providers to say, hey, what are you guys telling her? This is my patient. We should probably collaborate.
You don't work there, but you're a doctor and you're treating a patient who's got medical records that you could access through a HIPAA release, right?
Yes.
Why didn't you do that?
Well, she didn't ultimately end up having any treatment there, so it didn't seem necessary.
She didn't end up having any treatment there, so it didn't seem necessary. You can't just walk into that place and say, hey, I'd like some Zulresso, can you?
I don't exactly know how it works.
And then again, on that date, which would be October 20, when you were looking at the records, you checked off the boxes again on objective findings, mental status exam, appearance, speech, things of that nature, correct?
Yes.
Excuse me for 1 minute. Good. So when she was telling you on that date that she was in quoting your records, paranoid of getting suicidal thoughts and something bad happening, doesn't want to be alone. What did she mean by that?
Well, those were a lot of her words.
Right. Isn't that a concern? If your patient is telling you she doesn't want to be alone, why didn't she want to be alone?
Because she was very anxious and had the feeling like something bad might happen.
Okay.
If somebody's telling you that they're having the feeling something bad might happen, what does that tell you? What that says to me is actually that I might do something bad. So if I heard that, particularly from a woman, because remember, her alleged area of particular specialization or expertise or interest is postpartum mental health. Hello, if this woman is saying, I have postpartum anxiety, I have postpartum depression, all these meds are doing nothing at all except for making the situation worse, I am having SI, and now I'm telling you that I'm afraid to be alone with my children because something bad might happen. What does that tell you? It tells me that this person is trying to communicate with me in code that they're comfortable communicating in, that they might do something bad. That's what it's telling me. And I get it. This is a doctor, not a decoder. Fine. But you gotta be, you gotta know this person is severely unwell, severely. If somebody like this is reporting that they're worried about SI, worried about something bad happening, what does that actually mean? It means we are very close to the ship sinking. That's what it means. Because this is not a person, based on everything that they have all reported so far, who was going to tell them, oh, yes, I have a plan. And so by next Tuesday, if you guys don't save me, I'm going to end my 3 children. No, that wasn't going to happen. And by the way, this whole idea about having to have a plan, I don't even know where this comes from. Because the truth is, the people that I know that have either attempted or were successful, there was no plan. It just spontaneously happened. There were lots of thoughts about it previously, but when it actually happened, the event happened, it was a spontaneous event. I don't know.
Did her mother ultimately and dad come to stay with them?
Yes.
How long did they stay with them?
I don't know.
When you talked to the mother and the father, did you say to them, what is she doing? How does she appear? Is she in bed all day? What did they tell you?
They never called my office, so I never spoke with them.
They never called your office?
They never called me or sent a message, so I did not have communication with them.
So it's their fault that they didn't call you, the doctor, I guess, right?
It's a state. Next question.
So,
unbelievable.
Do you think maybe it would be reasonable if you're the doctor and you're investigating the patient's symptomology that you might, when you know that the parents are staying with her, that you would make a phone call yourself?
It's not typical when you have an adult who is able to advocate for themselves to speak with their parents.
So while she is telling you about her symptomology and tearfulness and crying and unable to get up and anxiety and the medications and the mental illness that she had, you felt that she could advocate for herself?
Yes.
So how about...
So here's the thing with this, right? First off, you can't just pick up the phone and call somebody's parents, right? You need a release to be able to do that. So you can't just pick up the phone and call anybody that is connected with your patient or your client, whichever lingo you prefer. You have to get a release. And because of that, there's a conversation that takes place. In other words, hey, Lindsay, your mom is coming. What do you think about having your mom come into session with us? Or maybe, because remember, this is all on Zoom. Or maybe, do you think it would be good to hear from mom for just a few minutes, have her sit in, have her join us because she's going to be staying with you and Patrick for however long? Something along those lines. Maybe she could be helpful. She could, whatever. You guys could get on a schedule with the baby. Like, that's the other thing. Lindsay has 3 children at home, and there's no discussion about that. Now, think about that for a second. Because she's not living in a box by herself. Every single day, she's engaging with her family, and now with her mother and her husband and her 3 children. So the more involved everybody is in her treatment, the more it comes out of the closet. It doesn't have to be this secret that she's holding on her own. It's something that everybody is talking about, everybody's aware of. And that way, it doesn't feel like something that she's carrying alone. That's probably what needed to happen here at a minimum. At a minimum. Everybody needed to be involved. And that's, by the way, as you're about to see, we're going to take a fervent break in just a minute, and then we're going to come back and we are going to hear from women who have had an experience of postpartum psychosis. And I would love to hear from you guys after what your thoughts are. But to me, this is something interestingly unique to itself, with symptoms that are awfully similar. You hear the same. I mean, I found as many as I could. I'm only going to play a couple here for us, but I went and found probably 25 women, as many as I could find. I listened to stories about what their experience was, and I could not believe how similar the pattern is. It's a very similar pattern, not exactly the same, but very similar. And it's not the same as this good doctor is telling us as traditional mania that you would see with bipolar disorder. There might be similarities, of course, but not the same. So it's very interesting and something that we just need to. The whole stigma for new moms, we just have to do something about it because it shouldn't be that way. Women should be allowed to be honest about what they're experiencing. Of course, we love our babies. It's not a matter of whether we love our babies. It can be the best of times and the hardest of times all at once. And that certainly was my experience. It was the best and the hardest simultaneously.
This November 2nd, was that the next time you saw her?
I saw her on November 2nd.
And she told you that she was hesitant to use the medications, the Buspire and the hydroxyzine, right?
She said she was hesitant to try the Buspar.
She was scared of the drug. She was scared of the drugs, right?
She was afraid to take a medication.
She wasn't doctor shopping and asking you to give her drugs so she could get high. She was asking you for help. Isn't that right?
Yes.
And she was afraid to take the drugs and told you that she was afraid to take the drugs, right?
She told me she was afraid to take the Buspirone.
Did you advise her or counsel her or give her therapy about that? Validations? So on the next page where it talks about
validation
goals, treatment goals, I'm sorry, symptom reduction and improved functioning. What does that mean?
Symptom reduction is to have fewer mental health symptoms, and improved functioning means improved day-to-day life functioning, things that she's doing in her daily life.
Really? Did you tell her all that?
Yes.
You're a young woman that's obviously mentally ill, very sick. She's deteriorated, whether you like that word or it's automatically imported. What on that date did you do? Never mind all those words you just said. What did you tell her on the television or the computer?
On the television.
I told her to go to the partial hospitalization program, and if she was having more suicidal thoughts again, or felt like she was at risk of hurting herself or anybody else, that she should go immediately to the emergency room.
How long did that meeting take?
Probably about 30 minutes.
And was that the therapy that you provided, telling her to go to the emergency room?
That was probably a component.
So, the plan, excuse me, on December 16th was to follow up with women and infants, right?
Yes.
Did she?
Yes.
Do you know when?
I don't know exactly the day. Shortly after.
Then you were considering a brexanolone infusion, right?
That's the Zulresso.
That's the same thing in Rhode Island.
Yeah.
Right? And that didn't go anywhere, right? That's
No.
It says start Lamictal, 25 milligrams daily, right?
Yes.
Continue Seroquel, right? What was the milligram for the Seroquel up to at this point?
Well, she had told me it was 200. I did not write that prescription, so that's what her provider had prescribed her.
Okay, right here. I mentioned that there's 4 alarm fires. This is a 10 alarm fire. This is like the ship is sinking, the lifeboats are out. The fact that she knew Lindsay had gone to some other doctor in the world and gotten a different prescription for Seroquel, which is not an inconsequential drug. It's not melatonin. Seroquel is a very consequential, I want to say that, consequential medicine, okay? It's consequential. Not that they're all not. They all are. But Seroquel is a no effing joke. And she knows it, our good doctor. Why are you not immediately picking up the phone, saying to Lindsay, listen, I need you to sign a release for me to communicate with whoever is prescribing the Seroquel, or I'm not comfortable continuing to work with you. What the hell is going on here? This was a huge mistake. This is such a mistake. If I'm on the other side as a civil attorney, I mean, to me, this is the end game, right? This is the end of the road for our good doctor, because this is so unbelievable. She's continuing to work with this person while other people are treating her and not communicating with the doctors who are writing the prescriptions. Like, what are you doing? You are not a psychotherapist. So then what are you actually doing with Lindsay? What is going on here? Do you see what I'm saying? What she's actually doing is undermining Lindsay Clancy's treatment, because she's essentially offering a second opinion. So now Lindsay has, because she's degenerating, because her mental health is falling apart, she's actually colluded. She's organizing it so that all these different practitioners who are not communicating with each other are giving her different opinions, which is only fostering more confusion about what intervention to pursue. And so once again, she's starting and then stopping and then starting and then stopping and then trying this and then not trying this. And this is facilitating that getting worse. Instead of being the buck stops here, which is what she should have done the second that she found out Lindsay went behind her back and did anything at all. It is so irresponsible, you guys. It's I don't even have the words. How you don't do that. It's unbelievable. And I know what they would say. I know what she would say. But Sam, Lindsay seemed so put together and she was such a good reporter. Unforgivable. Uneffing forgivable. It's unforgivable. At Sunny Days 100 is a new member. Yay! Welcome at Sunny Days 100. We're so excited to have you with us. Yay, new members. I feel like I need to get like a new member dance. Anytime we have new members, next time I'm going to play the Yuri dance, my favorite karaoke dance. It's like it needs to be played. We just need to do it. We definitely need to just do it. Hold on, guys. I'm trying. I'm working with a subpar computer system right now. I gotta know it sends $2. When they say Ativan 0.25, no frequency, 1 time per day, this is what I'm saying. I gotta know it. This is exactly what I am saying. I mean, there are doctors that are saying things like, well, take this and this, but if that isn't something you're comfortable with, then you can just take this and this. And this is somebody who what she really needed was somebody more like Nurse Paul, somebody with that type of temperament, authority, somebody who just like knows their shit and kind of commands the room to say to Lindsay, I got you. I'm going to take her by the hand and we're going to do this together. That woman did give her access 24/7. But unfortunately for Lindsay, she was too little, too late, and she was leaving that practice. But my guess is it's possible, although God only knows, it's not impossible that had Julie Paul stayed on, then maybe Lindsay, some of this would have been, or all of this would have been circumvented. I don't know. But she certainly was closer to what Lindsay needed. She needed a commanding person to say, this is what we're going to do moving forward. Because what is happening as an alternative is every time Lindsay has a feeling that changes, which is part of her mental illness, the doctors are changing what they're doing. And it's a reaction to Lindsay's anxiety about the medications to begin with. It's insanity. It's totally insane. It's exactly what are the symptoms of the very thing they're trying to treat. It's absolutely nuts. Really, really is. Iron Chef is a member for 2 months. Happy 2-month anniversary, dear. Says BTS has great messaging on mental health. They do, right? They are very, they're very, try to be very mental health conscious. Such good guys. Oh my God. I mean, at least publicly. Completely different culture and very interesting how it affects how they engage with fans and how they engage with each other. There's kind of a humility about them. Fascinating. I'm fascinated with K-pop because it's certainly not what I would have been into when I was her age, but I'm so glad that she is. I to this point I couldn't have a better kid, but I'm knocking on wood because I know at any moment it could just completely fall apart. At your dad's favorite Bob says 499. It's ironic how this doctor seems to also have such poor insight. I think, though, it's an act. I don't think she has such poor insight. I think she has a very acute awareness of the fact that she is on trial, that this is her saving her own behind. That's my belief. I don't think she's really lacking in insight. I think she's very aware, and I think she's she knows she missed it. She knows she missed it. So this is, this is life or death for her when it comes to her career. I mean, certainly, right? It's got to be almost all over. If Lindsay Clancy ends up being, well, I don't want to say exonerated, but found to be of not sound mind and body, and therefore going to a hospital instead of a prison, I believe Dr. Jennifer Tufts is very likely not practicing medicine anymore. That's my guess. Hello, my dear Madeira, sends $5. Wonder what's the scuttlebutt in the professional psych channels. Yeah, I mean, I've been, thinking about this a lot too, right? Because I want all my colleagues to be watching this trial, first of all, just because it's so interesting, but also I'm hoping that it at least moves the needle a little bit on women's postpartum health, mental health specifically, because this is a really serious issue that is just not getting the attention that it needs. It's really sad. It's horrible. It cannot continue to be an issue that we are just woefully underschooled on, under aware of. It's something that, all women who have a baby should be aware of. Their partners should be made aware of because, God forbid you want to be as safe as possible. This is a direct threat to the life of your baby. If it's 1 in 1,000, isn't that 1 in 1,000 too many? Ay, ay, ay. So sad and so terrible. It really, really is. Oh, what happened? Sorry, you guys. I'm dealing with my B team in terms of the keyboard and my mouse because I forgot them. I don't know how, but I did. So I apologize for the technical difficulties. At Love Knows No Word sends $4.99. I lost my brother to S in 2008. He was in a mental hospital after 10 years trying to get him help. Sadly, we haven't made much progress since then. So sorry to hear that. It's just horrific. So horrific. Depression is no effing joke. It is no effing joke. It's a very real thing. I mean, it's not in your head, right? I mean, this is a physical illness. And essentially, it's like the mind and body swallows you and you can't get out. And once you get to a certain level of depression, because the body is depressed along with the mind, you can't get out. And that's why ECT is an intervention that does help people, because it sort of resets the brain. That's why ketamine can be effective for severe depression, at least when it comes to eliminating the S part, the desire to want to take one's life. So sorry to hear that. So sad. Love knows no words. So sad. So tragic. So tragic. Hello, Gambit Kathy. It's so nice to see you. Since 1999. So sad. I worked in PsyD for 20 years. And unfortunately, too many students should never have received a license to practice like Tufts. LC, not guilty by reason of insanity. Well, first off, thank you for your contribution. 'Cause I think it's important, and you're probably right. I try not to think about that. You know, I am in school right now with a bunch of students who have not practiced clinically yet. I'm the extraordinarily rare, because I was going back to school to teach, not to practice clinically. And I definitely have those thoughts sometimes, but I try not to. I try to be like, it's okay, Sam. Everyone's going to be trained. You know, I try to think that way. I know they're well intended. I've not met a mental health professional that wasn't well intended. I believe that in my heart. It's just that it's not easy. I mean, it's a really hard thing to do, especially on the therapeutic side, because you're not just giving out meds. At least with the meds, although it is just as, if not much more dangerous, at least you know what you're doing. For new psychotherapists, they're just like, what am I doing? What am I supposed to be doing with this person right now? Like, what is my job? I remember I used to train new therapists, and I would start with that, because we all go through that, right? Like, what am I doing right now? I have no business being in here. I can't help anybody. I can barely help myself. It's funny. It's not funny, but I hear you, Gammy. I hear you. We're going to do a couple more of these, and we're going to go on our fervent break, and then we're going to come back, and we are going to take a much closer look at this postpartum psychosis. At Cat Lady Ballerina Official sends $10. I keep asking people when the last time they thought about capybaras, because you are either having delete or not having delete thoughts. If you're thinking about it, you're having them. Thank you. Thank you, Cat Lady. Because that is exactly my point also. If you're thinking about it, you're thinking about it. That's it, right? And if you're telling somebody that you're worried about thinking about it, what does that mean? It means that that person is afraid to tell you the whole truth and nothing but the truth. It means that person is withholding information and is trying to send you secret messages. That's what it means. Right? Is it just obvious to me? I mean, is that not just obvious to everyone? I don't understand. But I could see, having said that, I could see with Dr. Tufts, I could see her not seeing that. That part that I just said, I could see her telling herself, meeting with Lindsay Clancy, hearing Lindsay Clancy say, well, I'm afraid that it will get worse to the point where I am having SI. I could see her believing that. Because there is something that is just more black and white about how she presents. Right? Like, I feel like this person is looking for clear boundaries and clear guidelines and, nice boxes to check off. And when you set that up, when you set up boxes in your mind, like, for example, there's a box that's called anxiety and a box that's called depression. Once you have made the decision that people are in those boxes or that symptoms are in those boxes, you can't even see outside of those boxes. Because once somebody goes in, you can't take those same symptoms and move them into another box, because no, they belong in this box. That's part of the problem with the categorical model. In fact, that was going to be my first, when I started this graduate program. It's like my fourth graduate program, but I thought that was going to be my dissertation. I thought I was going to be doing a dissertation that was on that very topic, how categorical thinking, essentially in psychology, prevents you from being able to see symptoms on the full spectrum. Because once you make a determination about what category a symptom belongs in, you can no longer see that symptom in a flexible way. And it prevents you from being able to see the full range of possibilities of what's going on with a person, a patient, a client, a person in front of you. And I think that is very likely what happened here, either before, during, or after. I don't know if she's doing this after the fact, like hindsight, to save her own tush, or if this is really what she was experiencing in real time. And we have no way to know that, unfortunately. But thank you for that, because I agree with you. I could not agree with you more. If you're thinking about ducks, you're thinking about ducks. That's what you're thinking about, right? You can't think about ducks and then not think about ducks. You're thinking about ducks. You know what I'm saying? You could be afraid of thinking about ducks, but if I'm afraid of thinking about ducks, I'm thinking about ducks. Exactly. Hello, Jenny. Yay. I feel like the crowd, I need like the crowd sound. Jenny, happy 10-month anniversary, dear. Just want to say thank you, Sam, to your dedication in analyzing the cases that I feel so connected to as a Massachusetts resident, MS patient, and pharmacist. Well, I love you too, Jenny, without a doubt. And I am also connected to those things in different ways too. So we share that. We also share something else, Jenny, the Wizard of Oz. We share in our affinity, although you win, in our affinity for the Wizard of Oz, without a doubt. All right, so we're going to do our fervent break now, and then we are going to come back and we are going to hear from women who have themselves struggled with postpartum psychosis. So let me get this up and running. 1 second, because I am having technical issues, but it's coming, I promise. It's the worst thing. I thought last minute, maybe I'll run to the store and get another keyboard and another mouse, but I wound up not doing it because it was too much of a pain. Okay. Here we go. Coming. The technological issues that we all deal with every day. All right. Here we go. We will take our 2-minute fervent break. And when we come back, we will hear all about postpartum psychosis. Let me move this and remove this and get this. Here we go. We'll get there. I know we'll get there, everybody. All right. I'm going to put it on the screen. I just can't find it. Where is it? Hold on. Here we go.
I don't even know why.
All right, I'm
this
going to
is in
start
news.
from the beginning.
All of y'all are acting like prudes. Who doesn't like looking at nudes and sharing those nudes with the whole damn crew? Don't come at me with quid pro quo. I love that man. No homo. Not one text.
Technical difficulties. Here we go. For real this time.
The life of a proctor, defender. Send some text that might offend you. Lose your gun while you're out on a bender. That's the life of a proctor defender. That's the life of a proctor defender. Woo! That's the life of a proctor defender. I don't even know why this is in the news. All of y'all are acting like prudes. Who doesn't like looking at nudes and sharing those nudes with the whole damn crew? Don't come at me with quid pro quo. I love that man, no homo. Not one text that he planted evidence. That means that it is so evident there's no corruption. So what's the relevance? The feds found nothing except for these messages. They say there was a conflict of interest, but really we all had a common interest. Frame Karen Reed and we're in the clear. Then work with Kev on a cold case of beer. The life of a proctor defender. Send some text that might offend you. Lose your gun while you're out on a bender. That's the life of a proctor defender. That's the life of a proctor defender. Woo! That's the life of a proctor defender. Please judge, don't let these text out. He's been through enough and he's really stressed out. He's got Kerry Roberts backing him up, got Matt McKay backing him up, the district attorney backing him up, and Yuri, yeah, he gave a thumbs up. How about the Emmy? Not so much. How about the laws of physics? Not so much. How about Michael Easter? Not so much. How about common sense? Definitely not. The silent majority aren't on Twitter. For my man Chip, my hands on the trigger. Today in Canton, it's time to kill some.
No, sorry, Proctor, I can't say that.
The life of a proctor defender. Send some text that might offend you. Lose your gun while you're out on a bender. That's the life of a proctor defender. Here, Bear, take the mic. Tell him how you feel. Bitch, get out of line. I call her a whack job. Then I wonder why I got fired from my last job. All these Twitter trolls say I'm looking like a fat slob. Tell the FKR crew they're gayer than a flash mob. If I go to jail, please pick the right cellmate. Cause I probably pissed off every single inmate. They say orange is the new black. And as you know, I don't really like black. I can't help that. They annoy me. The only hood I like is white and pointy. Oh,
Okay, Jesus, Bear, please step away from the mic. White and pointy.
stop, you're making it worse. It's hard to defend you sometimes. The life of a proctor defender.
I put you on a pretty list. I'm gonna make you pay for this. Yeah, AJ's dangerous. Ooh, oh baby, I was born for this.
Yeah, I brought the West Coast to Dedham. Nobody is safe from my verbal venom. Put a witness on the stand and watch me shred them. Have them praying for peace, like the name John Lennon. A lawyer to match me? Well, I ain't met him. Don't believe me? Just ask Hank Brennan. Free can't read, and that was just the beginning. I'm never tired of winning. Got these middle-aged women waiting up to go swimming. Let's swim.
I don't get nervous. I make people nervous. I don't get nervous. I make people nervous. I put you on a ready list. I'm gonna make you pay for this. Oh, LAJ's dangerous. Ooh, I put you on a ready list.
Sorry, Paul Pierce, Ray Allen, and KG. The real big threes, you Nettie, Bob, and me. Gonna come with the C? Don't try me. You should know by now I always come with receipts. I'm out here penning letters like my name better roll. You got problems, Cox, and I think they're federal. Attorney Corey Hopkins, sure let them know. This ain't an episode, this a whole damn show.
I don't get nervous. I make people nervous. I don't get nervous. I make people nervous.
Ajax out here eliminating all you greasy motherfuckers. Ha ha ha.
I'll put you on a Brady list. I'm gonna make you pay for this. Oh,
Yeah, AJ's dangerous. Ooh, I'll put you on a Brady list. There ain't no party that can make out a third party. There ain't no party like a McAlbert third party. There ain't no party like a McAlbert third party. There ain't no party like a McAlbert third party. There ain't no party like a McAlbert third party. We got you right where we want you. We're gonna threaten you with defamation lawsuits. Got Alan Damon shaking in their boots. They scared they bit off more than they can chew. Hold on, wait a minute, what does that say? 23 pages in and I'm only halfway. How the hell did they call our bluff? We thought our empty threats would scare them off. Now they're out here calling us the House defendants. How the hell do we even contest this? Guess Karen really wants her vengeance. Oh shit! Now we're known as the House Defendants. House Defendants. We the House Defendants. It's not pleasant to be a House Defendant. Iggy getting tipsy off that Jameson and ginger. Never thought that I would be a penny pincher. The sweet whacker got me down to my last dollar. I still think she wants this decorated dude. I should call her. There ain't no party like a McAlbert third party. There ain't no party like a McAlbert third party. There ain't no party like a McAlbert third party. There ain't no party like a McAlbert third party. Now they're out here calling us the House Defendants. How the hell do we even contest this? Guess Karen really wants her vengeance. Oh shit. Now we're known as the House Defendants. House Defendants. We the House Defendants. House Defendants, we are House Defendants.
There it is. There he is. How good is that? Emily did such a good job. When you see the saxophone in the beginning with Brian Higgins, it looks so real. I don't know how she did it, but she did a great job. So just another great song from Fervent and an excellent collab with Emily C. So had to play that one. I rushed over here to get my mouse that doesn't really work well to play that for us. So awesome. I'm so glad I got to see it. Okay. Back to business. So I am going to play now. This is disturbing stuff. So I just want to give you a little trigger warning. It is very sad, and we are going to hear some difficult stories from women who have experienced postpartum psychosis. So if this is too difficult, I get it. I will not be offended if you do not want to listen to this part of our program. I understand. But given the circumstances and being who I am, I want to know. I want to make sure that if I'm saying that I don't think that this woman is guilty by reason of mental illness, that I want to be sure of it. And this is what we got to do to get there, in my opinion. So here we go.
I'd always been a bit up and down throughout my teens. I got diagnosed with depression when I was at uni, and I just thought that had reared itself because obviously moving and kind of new events. And I'd always wondered if something was wrong, but I just didn't know for sure, and I didn't know that it carried any risks, particularly not for obviously having children. So
you're 26, you find out you're pregnant, and the pregnancy was not plain sailing at all. I mean, the first trimester, really quite serious moments when you didn't know whether she'd make it through.
Yeah, I mean, I found out I was pregnant on the back of malaria, and so was a bit stressed. It wasn't kind of how thought I'd find out about the first baby that I was going to have. Yeah. And then ended up getting a UTI. I'm a paediatric nurse, so I had to inject myself with antibiotics, and then I got food poisoning.
So part of the reason why I wanted to include this story is because she's a pediatric nurse. That's what she does professionally, which I thought was interesting. I know the accent is a little thick, but hopefully it's not too thick.
And that was all in the first trimester. So
really stressful. Really stressful. And do you think that maybe some of the stress that she was going under at the time possibly could have contributed to what happened afterwards?
Yeah, absolutely. I think I've noticed certain triggers with Hannah, and when she has prolonged stress, it can trigger her mental health.
Yeah.
And I think that really was the start of.
Well, on the 11th of March 2015, Hannah comes along, happy and healthy for the first few weeks, and then her health deteriorated as well, didn't it? What happened to her?
So at 6 weeks, she had sort of symptoms of being floppy and unresponsive and having temperatures, and being a paediatric nurse, my head started to spin. And the first hospital we went to, we didn't really have much luck with the diagnosis, and they weren't particularly kind to me. And so Andy started to doubt whether or not it was in my head as well. And I eventually took her to another hospital where I'd previously worked, and we got a diagnosis of an E. coli UTI, but it took 4 weeks, and by then I'd not slept properly. I was stressed, and I'd started to question if it was in my head. So.
And so when, Andy, did you first notice that moment where you think, oh, no, this isn't right?
I would say around about that time, actually, when Hannah was getting really restless and lacking sleep, and she was up at all times of the night, and she started saying some strange things that made me think, OK, this is different, it's not...
You were watching telly, weren't you? It was Saturday night.
Yeah, that's right, yeah.
What did she say?
So this is following Esther's admission to hospital, and Hannah was saying things like, Britain's Got Talent. She, I can't remember the guy's name. Peter Lambert. She said, he's a really nice guy, and I think I want to marry him. And I thought, OK, that's strange. And following on from that, she started saying even more strange things. And then that was the weekend that she really deteriorated, and she curled up in a ball and started screaming.
Well, this...
Okay, so here's something important that I want to point out about what he's saying. And this is very different from what it would be like if you are with somebody who is having a bipolar disorder manic episode. You take one look at somebody who's having that type of mania, and you know something's wrong. He's talking about his wife watching television and turning to him and saying, he seems like a nice guy, I think I'm going to marry him. And it's weird. And he's like, okay, that's weird. But it wasn't as though she's, pressured speech and, talking about hearing voices or anything even of that sort. It's a delusion, right? This is important. What is a delusion? A delusion is a belief not founded in reality. That's what it is. And of course, delusions are evidence of psychosis.
Because it got really sinister, and this premise, you believed that you were God yourself, and then you believed that your baby was going to die, and then at 12 o'clock the next day the baby was going to die, and then the baby would come back to life again. So the minutes leading up to this 12 o'clock moment was when you collapsed, because for you this is real, and you think your first child, your newborn, this most precious thing, has died. I mean, awful, really awful. So what did you do? Because you didn't know about postpartum psychosis, you hadn't been diagnosed with it at this time. So what did you think was going on?
I didn't really have a concept of the fact that I was behaving abnormally. I remember getting stroppy around the Britain's Got Talent thing with Andy and my dad because I felt I was having some kind of divine intervention and they couldn't see what I could see. And when I was on the floor, I remember even Andy showing me that she was alive, but I was so trapped in fear I just couldn't stop screaming. And I remember wanting to stop, but I just physically couldn't. And then it was a family friend that got me off the floor and said, you need to get up because you're going to end up physically unwell as well. She said, you're really sick, Hannah. And that's when I thought, actually, she's right.
Well, that made you voluntarily check into a mental health unit, and there was a horrible week of mania and suicidal thoughts. You escaped 3 times, tried to kill yourself, very nearly succeeded, and then the decision was made to section you. And that, you say, was actually what saved your life?
Yeah, so I was sectioned and they put me up on the adult unit for 4 days away from Esther, and because I was so deluded and hallucinating, I didn't realise she was gone, but one of the carers said that she heard me on the 4th day screaming, where's my baby? And that's what made them bring me back down to the mother and baby unit. Being in that environment is what's made our bond so strong. And actually medication wasn't working for me, so I had ECT in the end, and that is what saved my life.
Hi, so I'm going to tell you about something that happened to me a while ago. I had a sudden, intense, temporary psychosis following the birth of my daughter. This was definitely not postpartum depression. This was so strange and so out there that I still sometimes have a hard time believing that it happened to me. At the time, I was married to a wonderful man, and still am. I was an attorney with my own professional mediation practice, which I loved, and we decided it was time to have a baby. Our future looked bright. We had no idea how wrong things were about to go. When I was in law school, I learned that some women can harm or even kill their children due to an imbalance of mind following pregnancy. But I thought that meant those other women, those women who already had major problems, not normal women, and certainly not successful, professional, educated women like myself. And so I was completely unprepared when it happened to me. I'm going to give you just a small glimpse of the worst part of my experience. So, I was on my bed, and my daughter was lying next to me, and that's her, cutie patootie. And I saw myself take a scissors and plunge it into her and cut her open from here to here. And there's blood everywhere. I turned away. I said, this has just got to be a bad thought, a bad thought. And I started gathering up every sharp item I could find in the room, purposefully not looking at her, terrified of what I would see if I did. So I took all those items that I gathered up, and I went to another room, and I put them in the back of a deep closet, thinking that if I was ever inclined to harm her, I would have to go there and get something out of the closet, and that would give me time to come back to myself. Which, by the way, I now know, of course, doesn't make sense, but it made sense to me at the time. I went back to my room, and as I crossed the threshold, I saw her there on the bed, cut open, with blood everywhere. And I thought that I had killed her. I don't know how long I stood there. I was home alone and psychotic. But eventually, I realized that she was just laying there on the bed, peacefully sleeping. It had just been a hallucination. And still, it was the worst thing that I ever experienced. Fortunately, I recovered from the psychotic symptoms shortly after that. And I decided nobody was ever going to know what I had been through. Because there's too much stigma, and I had too much to lose. But I wondered why I didn't know. I tend to be very informed and educated about things. I had gone to the classes, I read the books. How could I have not known about something like this? When I began researching it, a medical text that I found said that it would be obvious to anyone around the woman that she had psychosis. Well, obviously not, because my family and all of my medical providers missed it. The books that I found that did mention postpartum psychosis basically said simply that it was rare, or some went so far to say rare and a medical emergency.
Let's just take a moment to look at this list. Rapid onset, cognitive impairment, so that's impairments in one's thinking. Not wanting to be alone. Suicidal comments. Delusions, false beliefs firmly held. Paranoia. May hide their symptoms. Bizarre behavior. And of course, hallucinations. And the problem is, if someone is not telling you what they're experiencing, and they look like Patrick said when he was on the witness stand, it was confusing because she would say, I'm having thoughts about hurting the children, but then would go back to preparing bottles and being a normal mom. This is scary stuff, right? Because you could see so easily how and why a new mom would feel so alone, would try to hide it, would try to deny it's even happening. And that's something that I heard over and over again. I wasn't being honest with myself about what was happening, let alone to other people. Because it's terrifying, and especially if you're a labor and delivery nurse and you're supposed to know about this and you feel like you're supposed to be this perfect mother, more so maybe even than the average normal feelings of I'm supposed to be perfect.
So imagine my surprise when I learned this is as common as Down syndrome. So it's not that rare. It's just less visible. We don't see the 90+% of women who have this and who don't harm anybody and simply get well again. We don't see many of the suicides that result from this illness, or even many of the times when women harm their children but don't kill them. In fact, only a few of the infanticides make national news. These tragedies could have and should have been prevented.
Ready, Edda 1, Edda 2, Edda 1, Edda 2, Edda 3,
So cute, the baby is.
2 weeks ago, Dan's wife Laura gave birth to their first child. Just days later, she began experiencing violent nightmares.
Still breathe. Shout if you can't breathe. Thursday night, I dreamt that she had been battered black and blue right in front of me, and I just didn't see it because I was that knackered. That was Thursday. Friday, I had the same dream. So then I said to Dan, I'm not going to sleep because I'm not dreaming any sort of dreams like that anymore. So I stayed up 40 hours. Our next door neighbour, but one, got robbed when we first moved in, so we've always kept a hammer at the side of the bed. If I had gone to bed that night, I genuinely think I would have caved Dan's head in, because I was at the point then that the slightest little look or the slightest little remark or the slightest little body language, and I wanted to cave his head in. If he'd have been asleep, I'd have woke him up and just gone down.
4 days ago, Laura tried to kill herself and her family by crashing the family car at high speed.
Dan had not got his seatbelt on. I could see him in the corner of my eye going like that, going, babe, please don't. Babe, please don't. I'm begging you, please, please just don't do it. Please don't kill his daughter. Please, she needs a future. Honestly, it's not real. I was like, you're scared now, aren't you? I says, now you understand how I feel. Now somebody understands how I feel. I've been saying it for the last 2 weeks. I'm fucking scared. I'm scared. I'm scared. I'm scared. And I just went from 60 and I just went up and up and up and up. And we went round this corner and he saw the wall, and I told him I was smashing into the wall 70, 80, 90 mile an hour, and he saw that wall. It was less than 100 yards away. We were seconds from death.
Couldn't talk her down, couldn't stop her. What do I do? So I just pressed this button here. You've got a stop-start button there. I drop this into neutral and the car basically stops.
He saw the wall and he turned it off because we were seconds from death. I nearly killed my family.
Laura was taken to A&E and sectioned under the Mental Health Act. She's now detained on a mother and baby unit, receiving treatment for postpartum psychosis.
He needs to have to change him.
Postpartum psychosis is a very severe mental illness. It's like a psychiatric emergency. Quite often with these women, they've had no history of mental health problems, so it literally comes out of the blue.
Okay, let's take a moment here. Take this off. Just unthinkable, and yet this should be something that every woman learns about, every family learns about when they're pregnant, because by the time you are where Lindsay Clancy most likely was in September, when she starts to seek out psychiatric care, my guess is she was already way down, experiencing major symptoms. And I say that because this is someone who's not forthcoming with what she's really experiencing. She's not even really wanting to tell her husband the extent to what she's going through. She's telling one person one little bit of information, another person another little bit of information. You know, she's hinting at, not disclosing clearly. She's absolutely desperately afraid. She is reporting the highest level of anxiety a person is capable of reporting to another person. Lindsay Clancy. The highest level capable of being reported to another person is what she is reporting that she's experiencing. To me, when I see that, it sends off alarms that we are now in what I feel is very serious potential psychosis. When I see the highest level of anxiety playing out in front of me, I know that we are teetering into delusional, because we're talking about fears that are compounding on top of each other. And of course, when fears start compounding on top of each other, they become less and less realistic. So it's much easier, in my experience, to spot delusions than it is to spot outright hallucinations. Because people are scared to tell you unless they are so far gone that they don't think anything of telling you, but that's very rare. If you work in a psychiatric ward in a hospital, that's something you'll see frequently. Otherwise, it's just not something that you're going to come into contact with that often. Couple other things that I want to point out before we continue. I think I have a couple more stories. I actually have a bunch more stories, but I didn't want to overload all of us tonight. Couple other stories or things to be mindful of: prolonged periods of stress, no sleep, dreams that are scary. thoughts, the content of somebody's thoughts just getting worse and worse and worse. Obviously, thoughts of hurting oneself or others, imagining oneself doing horrible things. And the really scary part from where I'm sitting is that people around them are not seeing it. It's not obvious. It's not jumping off the page the way one might think, or like the DSM might say it's supposed to. Okay, let's keep going a little longer.
We had Ellie in 2021, so COVID was still very prevalent. It was very real still, so we didn't have any visitors because we wanted to keep her safe. And I do remember us being in the hospital with her, and I have a 10-year-old at the time and a 3-year-old at home, so it was just the two of us and her, and it was so peaceful and it was so calm. It was like overwhelming, kind of happy. I never knew like this was a thing. I had 2 other kids. I'm like, oh. I remember having a conversation with one of my friends that was pregnant, and she's like, oh, I'm so worried about getting postpartum depression. I was like, oh, I've never had it. I think I was kind of in denial. So, I'm like, oh, I don't need help. Nothing's wrong with me. Like, this is normal.
Things started going downhill. She stopped sleeping. I tried to get her help, like pastoral help, kind of try to get her into counseling, kind of figure out what was going on. So we really didn't know what was going on. And then I went out of town one day and I just had this stomach feeling that I needed to be back home, like something was severely wrong. And as soon as I walked through the door, she had tried to commit suicide.
I think if I would have gotten help sooner, it would not have escalated so far. I was actually diagnosed with postpartum psychosis, so it is a little bit different than postpartum depression.
Okay, so let's take a moment. Sorry, you guys. Okay, let me go back. So I mentioned some of this already. There are these different categories of postpartum mental health issues: depression, anxiety, panic disorder, OCD, PTSD, bipolar disorder, which is postpartum. So, and the difference obviously here is that it's triggered during the postpartum period within a year after having a baby. So obviously, with many of these women, half in fact, there's no symptoms of mental health challenges, no major mental health symptoms prior to the onset. For the other half, there are risk factors, history of mental health issues, family history of, let's say, bipolar disorder or some other psychotic disorder. Believe it or not, financial stress, poverty is a risk factor. So stress, things that are incredibly inherently stressful, like poverty and financial stress. So things to be mindful of, but I hesitate to even mention that because then we tend to want to say, oh, well, those boxes are not checked in this situation, so it doesn't fit. And what actually was the most alarming to me was that 50% of women with postpartum psychosis have not had any mental health challenges nor have anyone in their family. That is so scary. That is truly alarming. Just in terms of diagnoses, right? 5 or more specific, this is for postpartum depression, 5 or more specific symptoms lasting nearly every day for at least 2 weeks. I mean, I think every woman I've ever known after at some point in the first year after they have a baby falls into that category. And that's another thing that I'm learning just from going through all the research. these things are much more common, not the psychosis per se, but the postpartum depression. These are not uncommon experiences. It's when they don't remit, when they don't let up, when they don't improve. Very scary. Okay, we'll do one more. This one is very scary, very tough to hear.
Your call has been forwarded to an automatic voice message system.
Mom, I don't know what to do anymore. Mom, I haven't slept. I'm so tired. Mom, I think I really need some help. I'm so scared. Things are so weird over here.
Oh my God.
Can you call me back? I just need you to call me back. Okay, I love you. Bye.
It's absolutely heartbreaking to hear my sister in so much pain. She was hurting so bad. She needed help, and unfortunately, she didn't call me.
On May 20th, 2014, Carol Coronado stabbed her 3 daughters to death. Sophia was 2.5. Yasmin was 16 months, and Zena was 3 months.
And I first heard that Carol harmed her daughters. I knew she was sick. I knew there was something wrong with her. She would never harm her child. You don't do this on purpose.
Yeah. So I included that story in large part because of that last comment from a friend who says, she would never have done this. I knew she was sick because she would never have done this. And I've said it many times now, but women are programmed to lay their lives down to protect their offspring. It's in your biology. If that's not happening, if you're willing to take their lives and your own, something is wrong. Period. Full stop. It is not something that happens. It's not something that happens. Not something that just bloop comes out of the blue at 32 years old. Whoop. Now I'm a sociopath who runs around murdering my children. You know, that's not what happens. So, and when you start to hear the same themes over and over again, and one of the big ones for me is the denial, the sense that, no, it'll be okay. No, it'll be okay. But then what you're seeing is evidence in someone's behavior of them losing touch. And the only way that I can make sense out of Lindsay Clancy's behavior, even with the medications, look at the way that she's behaving around these medicines, right? So she seeks out a psychiatrist, knowing better than anyone as a medical professional that the psychiatrist is there to give you medicine. Goes, gets the medicine that she thought she wanted because she tells Patrick, oh, I want to go on Zoloft. So she goes to get it and then doesn't take it. This is that impaired decision making. I need help. I don't need help. I'm going to do this. I'm not going to do this. I'm going to do that. I'm going to do that. I'm going to listen to this person. I'm not listening to that person. And then she's doing her own research. And then she's up all hours of the night, right? She's becoming increasingly more hopeless about her situation. She's reporting some of it, in my opinion, in the hopes that somebody's going to swoop in and say, look, this is what's going on. This is what needs to happen. But nobody's doing that. And at the same time, you're not well. So you're equally conflicted about telling the truth. Someone's going to come in and take away your babies. And if you're somebody who keeps it all in anyway, who doesn't tell your closest friends about how you feel, and you feel shame and terrible guilt, I mean, what other conclusion, really, if we're being honest with ourselves, what other conclusion is there to come to when you start adding all these factors up? Now, from a legal standpoint, I am not a lawyer. I will never be a lawyer. Do I know from a legal standpoint whether or not, we need the jury instructions to go through and read line by line what does insane mean and what moments were Lindsay insane and not insane? All of that is another conversation. But looking at what happened here, I'm not sure what other possibility there is other than this woman was experiencing postpartum mental illness and most likely experienced postpartum psychosis. I do not know what the other possibilities could be. I would love to hear them if you know, or if you have an idea, but I'm struggling to see any alternative to that. I really am. I'm so behind you guys. Let me catch up to you all here. Silly little mouse. Oh my God. Look at this. And I'm coming in at the end here, and I apologize for that at Dandy Deb. My family sucked. My friends didn't know what to do, but walk away from a 20-year friendship. I can only imagine where that starts, but people don't know what to do with mental illness. They don't know what to do, and they get very scared. And that's also a shame. It's a shame. It's a shame. It really, really is. Terrifying. We need to work on changing how people understand what mental illness is, what mental health means, and figure out how do we do better at this, right? How do we do better? I mean, going through these stories, all I could think to myself is, how does the Commonwealth, how do these two prosecutors not do their due diligence before bringing these charges? How do you not sit down the way that I am and say, what are all the possibilities here of what could have happened? Before coming to the determination, because you saw a Facebook post about how Dawson was difficult in an attachment parenting message forum in a group on Facebook, that's the one thing that the police are able to find that makes Lindsay look like a bad parent. One thing. And it's in an attachment parenting group, which of course they don't understand. But by the very nature of the name of the group, it tells you that this is the kind of parent she wanted to be. She was so concerned about her children that she's in an attachment parenting group. That's a very specific way of trying to be a mom, and it's a very difficult thing to do with 3 babies. Arguably not possible. Under the age, 3 babies under the age of 4, were, such little ones. Ugh, so terrible. Hello, Sissy Pants. Thank you so much for helping us tonight. You are the best. And everybody, don't forget to be here on Wednesday. We are going to celebrate my sister and the launch of her new channel. The entire trial is about her mental health. So that's what we're doing here. Justice for the children is what we seek. Absolutely. Absolutely. Justice for those children. Trying to figure it out. That's what we're here to do. We're here to figure it out. Try to understand what the hell happened here, because this is not something that women are programmed to do. Something happened here. Something happened here. And when I went down the rabbit hole of seriously investigating what postpartum psychosis looks like, you start to hear these same themes. You start to get a sense of why it is that we're all scratching our heads here, listening to the prosecutor present her case as though Lindsay was just the most normal, loving mother, perfect parent who then decides to take the lives of her 3 children and then fakes an S attempt by throwing herself out a window. I mean, obviously, they don't even know how to put into words their argument. That's because their argument doesn't make sense. And I understand that some people just feel like, who cares if she was mentally unstable or not? She did this, she belongs in prison. I completely respect that argument. You know, I get that. From my perspective, I'm trying to figure out as a mental health professional what the hell happened here, because something happened. Something was not right. And the only thing that is making sense, given what we are learning, and as I said in the beginning, I am open if new information comes in that updates my understanding of this case, I will present it without blinking an eye. But as of right now, there's no other logical conclusion to come to besides she was extremely mentally unwell and they did not catch it. These mental health providers did not catch it. They did not communicate with each other the way that they are supposed to as responsible practitioners of mental health. They did not catch it. Horrifically, they did not catch it. Oh, it's unbelievable, you guys. Unbelievable. Hang on. I'm trying to update I'm trying. God damn it, I'm trying. Hold on. For some reason, I have this mouse and it does not do anything that I want it to do. I'm trying, Ginny, to get past your little message here, but for some reason, it will not let me do it. Oh, it's so annoying. At Cece sent 1999, and Cece, I am not able for some reason to put this on the screen right now, and I don't know why. Let me see if I can do it this way. Hang on. Sorry, you guys. I do not know what the malfunction is, but there is a very serious malfunction right now. Well, anyway, let me read it because I can at least see it. At CC Headband Cupcake Law Nerd. Hi, CC. It's so nice to have you here. She sends 1999 and says, listening to Tufts read her assessment of LC felt like an expert clinical analysis and more like a painfully slow read aloud of Google search results. So green. I know. I wish she had handed over care to the more experienced. Yeah. And I mean, the other thing about it, and this is what I think Reddington brought out so well today, was that she was really inexperienced. And yes, she did see thousands of patients during her residency. I get it. But truly, she walked out of residency and literally into Lindsay Clancy's life. And she was putting herself out there as though this was her area of specialization. And that's why somebody comes to you, right? Why would Lindsay Clancy been attracted to her to begin with? But for the fact that she puts up on her website or the company's website that this is what she does. And as I mentioned to you guys over the last couple of days, it's not inherently a bad thing to be a less experienced psychiatrist, but it's the nuances is where mental health lives, right? The nuances is especially with people who are much more severely ill. You have to be able to get outside of boxes to be able to see clearly what's going on. And I know sometimes shit happens. You know, I've had clients who I had a sense were going to take themselves off their meds, and I knew it, and I probably should have called the 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 emergency contact to say, "Hey, watch for them taking themselves off their meds because they're more manic." And I didn't do it because I didn't want to injure the relationship with the client. And so I waited too long, and then they did take themselves off their meds, and then they wound up back in a hospital because I hesitated because I didn't want to injure the relationship with the client by going over their head and calling their parents, knowing that they would not have forgiven me for it, no matter what the outcome was, and they wouldn't have. But in that case, I most likely should have called because of the possible risk factors involved with what would have happened, what does happen with this person when they don't take their medication. Now, I did not think there was a risk of life-threatening injury, but I knew there was a very real possibility that they'd wind back up in the hospital. So I get it. We have to make very difficult decisions all the time. And maybe that's what she was thinking. I don't know. But when somebody is telling you that they are thinking about scary thoughts, thoughts of harming themselves, thoughts that they are scared something bad is going to happen, and you are an expert or somebody whose specialization is in postpartum mental illness. Could you imagine? I mean, if that's something that you have a particular area of knowledge in, this woman would come into your office. So just put your hat on for a sec, your mental health hat. You're a specialist in this. Given what the limited things you've just looked at minutes ago in the list that I read, right? So prolonged periods of stress, pediatric nurse is what we saw, saying that her head started to spin because she was so overwhelmed. She hadn't had sleep. She was extremely stressed. She didn't know that she was as unwell as she was. She was successful, no history, no major history of mental illness. Dreams, thinking about hurting themselves, thinking about hurting the baby. If you know all of that, and then this woman comes to you and says, my main concern is postpartum anxiety and I'm not sleeping, the first thing that would set off is every alarm bell that this is a very serious situation, right? That's the first thing that would happen. You'd start going, okay, we are in very serious territory from the beginning. Then you see the reaction to the Zoloft up for 48 hours. That would be another indication of very serious issues here, because most people do not have that type of reaction to Zoloft. They just don't. They don't stay awake for days. So that should have been another big red flag. And there's so many. I mean, we could spend all day going through them. There was 14 appointments. 14 opportunities to pick up the phone and say, hey, something's not right. We got to get this person help. And none of these people talk to each other. That is the part I will never get over. I cannot imagine how that's even possible. I really can't. I really can't. Oh, wait. Oh my God. Did I have some movement? I think I was able to move the, hooray. Yay. Okay. Taco Rock sends the 450 joules and the butterfly. Yay. We got the goat trophy from Laura, Bethany Beach, DE, because that's Delaware, probably. We got Jammin' from Leslie Raymond. Thank you so much. Leslie and Miss Chris Al, I like it, sends 1,000 jewels and the goat trophy. At Summertime Dog sends 200 jewels and jammin'. Thanks, you guys. You guys are awesome. At Lily Miller 3522 sends 200 jewels and sunshine. We need some, lighter, lighten things up a little bit, right? At Mel Barrett 4901 sends 499. Yay! Just wanted to say it was great to meet you on the fundraiser. Thanks for covering LC with your expertise. It's desperately needed on this one. We were just talking about you, Mel, and we were just saying how it was so nice to meet you. And we got to do it. We got to do a collab without a doubt. 100%. We can't, not going to slack on it. We got to do it. Thank you. Thanks so much for being here. I'm excited about it. We got to do it. We got to do it. I'm sure Emily has your phone number, so I'm going to ask Emily to give it to me. This way, we don't have to do the email thing because I'm super bad at email, as all these guys already know. You guys know it. Oh, Gamey, happy 4-month anniversary. Tufts is incompetent. She is, though. It's so bad. I feel bad saying it because, she handled herself well on the witness stand. I don't know. I probably would have broke. I probably would have been like shaking, being attacked by Kevin Reddington. I'd probably be like, she did an okay job. I mean, she's being accused of medical malpractice, basically. Some of what he's saying is actually, it's funny. I mean, not really, but there are these moments where, it's like when he talks about being on the TV, I think it's funny. I'm sure the jury thinks it's funny as it can be, given the circumstances. But how do we come to any other conclusion but there's a level of incompetence here because of what happened? And it's not like Lindsay wasn't in front of her. She was in front of her 14 times. 14. It's a lot of times to be in front of somebody. Dr. Tufts is the one constant throughout that entire period. So Lindsay obviously felt something about her. And it makes me wonder if Lindsay was really hoping that Dr. Tufts swooped in to save the day somehow. Maybe that's insane. Maybe that's not the case. Maybe she was just working with her because she needed some, paperwork for work. I don't know. But that's a lot of times. And she didn't have to keep going back to her because she had all these other doctors in the mix. I mean, that's my big complaint with Dr. Tufts is, why did you continue to treat her even though you were not prescribing medicine for her anymore? Because what is that doing? You added another doctor into the mix while different doctors are actually prescribing medication. So you're kind of going behind their backs too, these other doctors, and you're saying, well, here's another medicine. I'll prescribe you another medicine. There's no doubt that there's some very serious issues in here. I mean, this is not above board. This is not standard. Please don't think this is normal stuff. It's not normal. It is not normal to not have your doctors who are mental health professionals completely not communicate, even within the same practice, let alone outside of the practice. If you go into a mental institution, it's not normal for those doctors and those people on the intake team to not call your treating psychiatrist to say, hey, what the hell has been going on for the last 4 months? It's not normal. Nothing okay about that. Please, if you're ever in that situation, if you ever have a loved one in that situation, say something. Did you call their doctor? Here's the number. Call the doctor. At Get Back Loretta 51. Welcome. Yay. Get Back Loretta's a new member. So excited to have you. Thank you so much for being here with us. song bits Laura 13 months. Oh my God, it's 13 months together, song bits. That's crazy. These people who think, oh, Elsie was drug shopping. No, she was not drug shopping. She was definitely not drug shopping, because if she was drug shopping, all those bottles that she gave Patrick to get rid of would not have been on the elimination list, right? You'd keep those bottles. You wouldn't give them to Patrick. You would want them. No, she's not veg shopping. She's reporting that she was drinking, what was it, 5 drinks a week? Was that what it was? 5 drinks a week, though we don't know what the drinks were, and feeling incredible guilt about the 5 drinks. And this woman, she is a walking anxiety attack. Everything she does and says, every move she makes, she second guesses, and it's getting worse as time goes on. She's really not well. She's really not well. I think you're right, Songbits. I would agree with that. I think that's exactly right. I think she's just really, really unwell. There's no other way to see this in a way that makes sense. I'm open to hearing other ways, but I have yet to find one. At PR_23 sends $4.99. My BFF is 40. She's been hospitalized for bipolar disorder, I think, 3 times. Her psych has access to her. Exactly. Thank you. Yes, it's absolutely not unheard of. No, it's not unheard of at all. Yeah. In my practice, it's standard because I work with young adults, as I said earlier. So, and young adults, by the way, does not mean 22. It means anything 22 to 45, right? Basically, what it means is anybody who's not financially independent. That's really what it means these days. So if I work with somebody who is an adult, but whose parents are still paying for them because, they're struggling for whatever reason, then we communicate with their families. And sometimes I become an integral part of their families. Sometimes your families call me regularly, a couple times a month. Sometimes the families will call me before they call their kid. And not just families. I've worked with spouses and partners and, siblings. You're absolutely right. It's nowhere even close to unheard of. If somebody has a major mental illness, the standard operating procedure is to collaborate, particularly if there's a psychiatrist and a therapist. Those two need to be in lockstep. There needs to be communication. At a minimum, if I can't get the psychiatrist to communicate with me because, they're psychiatrists, sometimes they can be, like I said, a little narcissistic. I will just send emails endlessly, just so they know, whether they even read them or not, I don't care. I'll just keep sending them emails that gives them updates about what's going on. So at least they have the information, because I'm the one who's getting to know them, right? The psychiatrist is with them 20 minutes every 2 weeks, and I'm with them at a minimum every week for 60 minutes. And usually in the beginning, it's much more than that if somebody's really mentally unstable. So I'm the one who knows them. And I'm writing books and novels to say, hey, this is what's going on, just to make sure that they know. Yeah, it's the situation with psychiatry is it's set up for disaster because they're the ones prescribing medications, but they're really not savvy as to what's going on with that person. So they don't see the degree of side effects or effects because they just don't know them as well. Really needs to be a complete collaboration. And so the model that Astor Medical was using was a good model. They just weren't practicing what they were preaching. At Tina Art Angel sends $20. Dr. Katarina Dalton of the UK pioneered progesterone hormone therapy for severe postpartum depression. OB doctor I worked with in the early 80s followed her guidelines for the same. I wish all OB doctors were this aware. I could not agree more. Actually, Tina, I wish all doctors, OBs, psychiatrists, I mean, we all need to be aware of some of this. I feel like postpartum depression is something that we have more of an awareness of. At least I have much more of an awareness of. But postpartum psychosis, it has such a specific, palpable set of symptoms with it. It really seems to me like something distinct and different from what we would traditionally call psychosis. So when I heard Dr. Tufts saying, well, any screen for mania would have caught it, I don't think that's true. I don't think that's true. I think that was dishonest. I'm pretty sure she would know that's not true. Right? She's just, again, really trying to cover her tush because, yeah, if she still wants to be, she did go to medical school. If she still wants to practice as a medical doctor, she has to cover her butt. Oh, horrible. Thank you so much, Tina. Yeah, we got to do something. We got to do something. At hello times 5M sends $10. Okay, I can't take it anymore. And not try to take away from the case. I can't take her, but she is an actress with no emotions. I have tried all weekend to figure it out. Also, this chick sucks. Okay, I can't take it anymore. I'm sorry, I'm just reading this again so I can process it and not try to take away from the case. I can't take her, but she's an actress, no emotions. I've tried all week to figure it out. Also, this chick sucks. So, she is an actress, no emotion. Is she an actress with no emotion? Well, Lindsay Clancy is probably medicated to high heaven. I really want to know now what the meds are she's taking now. Because all through the pre-motion and pre-trial stuff, they were saying that she was still suicidal or that she reported wanting to hurt herself, whatever. I don't know what she's taking now. I imagine that she could be, I'm not saying she is, she could be severely medicated. I don't know. The problem with the idea, and I will just tell you flat out, the problem with the idea that Lindsay is an actress is that it means she would have been an actress her whole life, because you don't just become sociopathic like when you're 30 years old. That doesn't happen. So, and that's the only way that you could feasibly take the lives of your children. Now, she might be a lot of things. You could absolutely call her any name in the book. And I get it. Believe me, I get it. What she did is unforgivably horrific. The question that I am asking is why? Because it's just not something that people do at 32 years old after, wanting to dedicate your life to being a helping professional. Now, I have a lot of theories that we probably don't have time to go into tonight about her as a person. And I probably need some more information to be sure. But I get it. Like I said, I understand. I understand hating her and, I get it. Completely understand. But I hear you and I am trying to figure it out myself. I really am. At hello, X5M sends $2. Same hello. I struggled and lost. I don't know what that means. I wish I knew what you mean by struggled and lost. I don't know. It's tough. I really wish. So I wonder what you guys think of this. What do you think of the sobbing in the courtroom? I can't see. I hear her. I heard her the other day when she was crying. But I don't see her. I can't see her. Is that faking? And I'm asking, I can't see her face to be able to say that it's faking. It would be extremely bold, an extraordinarily bold move to fake that in front of the jury, to fake cry, I mean. So could people do it? Yeah, I really believe, by the way, I know the prosecutors are denying this, but I really believe that they believe that she's faking the whole thing. The prosecutors. They're denying it now because I think they see that it's unpopular and they don't want to take the completely unpopular position. But I do think that's the case that they're presenting. The only argument that makes sense from their perspective, after spending witness after witness showing us how the cuts were not deep enough and were not serious and she's not really taking that many meds, the whole thing, it appears as though they are arguing that she faked the whole thing and tried to manipulate the doctors, I guess, the whole time planning to end the children and then fake an S attempt. Which does not make sense. Like, and by the way, the other thing too, this is, what kind of life is Lindsay Clancy ever going to have again? I mean, really though, seriously, what kind of life is Lindsay Clancy ever going to have again? Now, of course, the fact that she is alive has meaning. Her children are not. But what kind of life is Lindsay Clancy ever going to have? Whether she's in a hospital, whether she's in a prison. I mean, look, if she's in the kind of prison that Mackenzie Shirilla is in, it's basically the same thing as a hospital. Maybe you could argue even a better situation. She could be in college for the rest of her life on the state's dime, right? If that's what prison is like, if where Mackenzie Shirilla is what prison is like, then I am changing my opinions on women's prisons also, by the way. But maybe that's another conversation. But she's in a wheelchair. Sometimes, because of the complications related to those types of injuries, people's lives are cut short. I don't know the full extent of what her injuries mean. She's got to be medicated psychiatrically to the highest level just to be able to be in the room and sit there. What kind of life is she going to have from now on? I don't know. I don't know, but I really would love to hear from the person treating her now. I forget his name. The guy that sits next to her parents in the courtroom. He is going to be a very interesting witness. And I guess he's coming soon, right? Because the Commonwealth is almost done with their case. Very close to done. From what I understand. I don't know how true that is, but that is what I heard. Madeira sends $5. I can't wait to hear why the ER sent her home. I know. Why did, the ER or the infants program, right? The mothers and infants, why they denied her for their program. Now, during the opening, I think Reddington said it had something to do with medications, that she was taking medications that she couldn't be on if she wanted to be in the program. That didn't sound right to me because the medications that she was taking, well, first off, they never called her doctor. So that's number one. Hello. And then number two, at that time, she'd only been on the medications for a pretty short period of time. So I don't know. The whole thing is very screwed up, Madeira. I don't know. It just doesn't, and it also doesn't make sense. It doesn't sound right to me. Like something isn't right, right? Something is not right. So frustrating. It really is. At Laura Bethany Beach, Delaware, says Dr. Tufts is definitely in the wrong area of medicine. Absolutely. She may want to change to something like research. She does have more of a research personality. She's very controlled, right? Very absolutely. I totally agree with you. Amy McEels? Is that right? McEels? I was going to say Michaels, but I don't think that's what it says. Hi, Amy. Sends 10 jewels and Gigi and a butterfly. Thank you so much, Amy. And this was the one that I was trying to get to earlier. Yeah, I wish she had handed over the case, Cece, to somebody more experienced, without a doubt. Without a doubt, you guys, without a doubt. At Joy for Truth and Justice for John O'Keefe. Hi, member for 9 months. Happy 9 months. Happy 9 months, Sam. This case is so incredibly sad. The failure on the part of the medical professional makes me sick. Thank you for all you do. We love you. And I love you guys, and it makes me sick too. It makes me so sick, and it makes me really mad. Like really, really mad. Because how do you miss this? And I want to show you, before we go tonight, I want to show you one more part, because I really think that she knows. I think that our good doctor is aware that she missed it. I think she knows. I deep down inside think our good doctor knows she missed it. I really do. At Legendary Zero Legacies sends $9.99. My mom was diagnosed with manic bipolar. It's nearly impossible to actually understand all that comes with it until it's experienced. So true. Confusion to mental torture to doctors, med swapping. It's horrendous. Yeah. The other day, I heard Melanie reading a comment from somebody, and it stuck with me because she was saying that it was like her brother. I don't remember the person's name, but she was, sending a super chat to Melanie, and she said, "My brother had I think it was major depression, had a mental illness, and at the end he got cancer." And he had said before he passed that the mental illness was so much worse than any medical condition could ever be. And I think that's something that it is such a stigma in our culture that we don't talk about it. But I always say, if you don't have your mind, what do you have? And that's another thing about these medicines. We can trivialize them. The district attorney can trivialize them. High dose, low dose, whatever. She's taking medications. She is taking them. She's taking some of them. She is mixing them. Nobody's talking about what happens when you mix medications, because that adds a third element. So it's kind of like when you have a group of people. So let's say you have you, and then you have your best friend, right? So it's like you and you have your best friend. In college, I met these two women, my very first week in South Carolina as an undergraduate. I met my friend Jamie, and then a couple of days later, I met my friend Janet, I think first, and then a couple of days later, I met her roommate Jamie. And together, the three of us were like one thing, and we had one way of engaging with each other. Like when we were together as the threesome, it was one thing. But then when you took me out of the equation and it was just the two of them, it was a completely different animal. And then when it was just me and Janet, we were a completely different animal. We wound up living out in Montana together. But when I was with Jamie, she was from Long Island. We wound up in New York City living together. And I use that as a silly example to say, medications are similar in that you have one medication, it does one thing. But then you add another thing, and now you have two things. And those two things are now a third thing. They're a dynamic. They're not just two separate medicines that do the exact same things they would normally do. They're working now together, and they change the properties of the first two. And then if you add another thing, whether it's Benadryl or melatonin or anything else, fish oil, how many times, I don't know how many times you've been told, but how many times have I heard from different doctors saying, hey, be careful with supplements. They might seem like they're no big deal because they're over the counter, but they can be freaking very dangerous. And boy, is that true. And boy, did I learn that the hard way when I was a kid, very young, 18, 19 years old. So these are not inconsequential. That's something else we have to keep in mind. I just think that the way she was using these medications, they were really just facilitating more of her falling apart because she wasn't sticking with any one protocol. There was a lot of jumping around, mixing, jumping, and the drugs she's taking are facilitating the symptoms she's already having getting worse, right? Because she's telling them she wants to sleep. So then they're giving her a depressant, actually a bunch of depressants, which doesn't really make sense because Dr. Tufts is saying, well, she's terribly depressed. If she's terribly depressed, why would you give her medications that are depressing her even more? On and on it goes, guys. On and on it goes. It just keeps going like that. So it's a nightmare. And at Legendary Legacies, I get it. Thank you for sharing because it's so hard when it's when it's your parent. There's almost nothing harder when it comes to, it's very, very tough to have a parent, especially who's suffering from mental illness. I mean, it's very unpredictable and you have to worry about if they're taking their meds and if they're taking them as prescribed. And it's a nightmare. Really, it really is. It really is. And I've said it many times, that's one of the biggest threats that we have to mental health is people don't want to take their meds. And so they stop taking them, take them when they want, and it really screws everything up terribly. Mimi Nina 67 sends girl power. I love it. And she sends 10 jewels and the happy poop guy. And at Max0320, Okla sends 350 jewels and the finger heart. Thank you so much. Oh, yay! Mimi became a new member. Welcome, Mimi. That's so exciting. Yay. Welcome to all the new members. Make sure that you check out the courses, the mental health courses. This is probably a good time to mention that. Oh, and don't forget to hit the like button. Oh my God, we're at 4 hours. Holy shit. 4 hours. It feels like 10 minutes that I've been sitting here. Really, it's crazy that it's been 4 hours. That doesn't even make sense. So don't forget to hit the like button, like immediately. Welcome to all the new members, and it's a good time for me to mention the classes. So there are 2 classes that are incredibly extensive, available to all of our members. One is on parenting or for loved ones and substance use disorders. The other is on just mental health. And actually, that one is very, very extensive. And there's even sections in there that I think would help people to understand Lindsay Clancy, because I talk a lot about people that are people pleasing and how that can lead to issues with, I'm trying to think about how to say it, decision making, not having a sense of self to the point where you don't know what's right, you don't know what's wrong, you don't know what decisions to make, you don't know who to turn to for help because you don't know who to trust, because you don't trust yourself or your own judgment enough to even be able to say, oh, well, that person is the right person to listen to. And what she's doing is going then home and going to Google and doing all this research. And that research by itself feels pressured, feels a little manic, right? Spending hours on Google looking at different medications. Okay, well, Sam, she's just trying to be responsible. Okay, maybe. But when you start adding that with the way that the words in the journals, the way that she's communicating even to the nanny, the way that she's, talking to Patrick, the way that she's talking or presenting herself to the doctors. It's very anxious. And then again, of course, she's also reporting the highest level of anxiety that a person can report. And again, remember, anxiety, if we take it all the way to the most extreme, we get into delusion, right? Thinking not based in reality. Fears, like people are watching me, people are following me, people are out to get me. Something bad is going to happen. What if something bad happens? What if? We've all been really stressed or really anxious or afraid at some point about something. Hopefully never anything like this though, because this is tough. Very tough. At Joy for Truth and Justice for John O'Keefe sends 6-7. I think I do this or something like it. I have no idea what it means, but I have a 12-year-old who's about to be 13. So Andrea, hello, Andrea sends 19.99. Hi, Sam. I love your videos and channel. I can't help applying my experiences with psychosis to, yes, of course, Lindsay. You said IYO. She made a decision after she left McLean. Wouldn't that mean the command hallucination was fabricated? Yeah, it's a great question. I know, Andrea. This is the one question. And I'm glad you called me out on it because it's the one question that I still have. It's the one question I still have. It's the one question that I still have. Because it's very unlikely that she would have had no hallucinations at all, nothing, before that or after that. And I don't know where we heard that. I don't know if that came like from us. In other words, did we just make that up that she never heard anything before or after? Did that come from pretrial motions? Did that come from Reddington? I don't know where we were told that Lindsay reported never experiencing any hallucinations at any time until she heard the command hallucination or the voice that told her to M the children, or after. That's very, very, very rare. Now, it doesn't necessarily have to mean that a voice was talking to her. It could be any hallucination. Just very rare to be given, to have one moment of hallucination, period. And so that's my one question, I guess. The thing that I am the most uncertain about. Could I see a world where she was obsessed? I've seen this. When depression gets to the point where somebody becomes utterly fixated on ending their life. I see it all the time. In fact, I have a couple of folks that I've worked with for a long time who it creeps back in. We've worked really hard so that they don't have to live with it every day. But when there's a certain type of trigger, these kinds of things creep back in, or when their moods drop to a certain point because of stress or whatever. And then they become kind of re-obsessed with S again. And we have to go back through the process of unhabituating those types of thoughts. So I know that people can get very fixated on it. And if she deemed the kids to be the one thing that's keeping her around, then I could see a world where they become, that becomes the reason to bring them along, right? The only thing about that, the way she went about it was not conducive of success, right? Like if you really wanted to do this and you had the presence of mind to plan accordingly to succeed at it, which is what most likely would have had to have been true, then this is not the way to go about it, in my opinion. I mean, you know what I'm saying? You'd find a much more, I mean, she had endless access to medications. She could have taken all of them. She could have crushed up all of the bottles that she was given and been much more likely to succeed. Unless it's rushed. Unless it's rushed. Unless it's a go now, do not pass go, do not collect $200, go right now and just do whatever you have to do to achieve the goal. So there's that. I could also see a world where after the fact, she recognizes that the way out of this involves a command hallucination. You know what I mean? Because she's done a lot of research already. She knows the lingo. So I'm not sure. I'm not sure, Andrea. It's a really, really important question, and I'm not sure of the answer. I'm really not. And I'm also, I will completely admit this, I'm also not sure I understand what the standard is. Everybody keeps saying, didn't know right from wrong, but then there's this or clause in the Massachusetts law that says couldn't conform her behavior to the law. And that seems a lot more feasible to me. And it's an or, it's not an and, it's an or. In other words, if I'm being driven by some compulsion to take this action, you know, that exempts me from going to prison according to the law. So I don't know. We're going to have to wait for the jury instructions for that part of it. But this is the question that I still have. And I think, Andrea, in order for me to be able to have an opinion, we're going to have to wait for her acting, current, treating a psychiatrist, the person that Reddington brought into the room that she initially tells this story to. He's going to be the guy that we ultimately, I think, have to hang our hat on one way or the other. But it's a great question. I do not know the answer. But good call by you for pointing it out, because that is the very thing that I don't know. I do not know. And I could see a world where that's what got her in trouble, because had she not said that, then it wouldn't have been so, like, it wouldn't have seemed like forced or fabricated out of nowhere. I think that's what made the prosecution, like, that's what made their antennas go up, that this was BS. Was, oh, now all of a sudden after the fact, you're saying that a voice told you to do it. You know what I mean? So I don't know. But she also at the same time was so unwell, you know, it's not impossible. But we are going to find out together. We really, really are. We're going to find out together. So you'll be there when, yeah, we'll be there together. We'll be there together. And thank you for sharing your experiences too. You know, this is hard stuff. It's really hard stuff. I mean, it really pushes you to have to ask yourself really tough questions that suck. These are three beautiful little babies. It's unimaginable. It's absolutely horrific. And like I said, I think her quality of life is basically over anyway, no matter what happens. So at this point for me, it's really a question about what actually happened, like what really happened more than what should happen. And she's a member for 6 months. Yours is the only channel that I'm a member of. Oh, I feel so honored. Thank you so much, Andrea. No, I really am honored by that. I get it. Like, I really appreciate what that means. And I so am honored. Thank you. Truly. And at Joy for Truth and Justice for John sends the floating hearts and the sparkles and the flower. I love them. They're so cute. I really wish we have to figure out like why can't I show them to you guys? I think that's so annoying. It's so obnoxious. All right. So let me just make sure. I think I was going to show more, but I feel like we'll be here all night if we keep doing it. Let me just make sure I get everybody. I don't want to miss you guys. I hate when I miss stuff. Let me double check. I know it's late. My poor sister is covering. Poor sister's been here for so long. Okay. Oh, wait. Oh, I almost got it. For those of you that have a Mac, they're amazing, except for this one issue, which is that you have to try to use the space bar to make the little like sidebar thing come up onto the screen. And if you don't have the right mouse for this, it is a very tedious operation, or the right keyboard for that matter. That's the problem right now. I don't have either, and it will not show up on the screen. So, but I'm trying. Here we go. Oh, wow. Okay. At Butterfly Ears 60 cents $5. Perhaps Lindsay had heard voices previously. Well, that's exactly right. But was afraid. Fear of being removed from the children. Yes. So Butterfly Ears 60, that's exactly right. That is my guess. So my guess is it is very possible that she was experiencing first delusions, so beliefs that were not born in reality, because that's what the anxiety could very easily start to turn into. And she was experiencing hallucinations, but was not willing or able to admit it. I think Lindsay Clancy is guilty of just living in terror of not being able or willing to speak. Now, speak her truth. And I will tell you this. The prosecutors made a point to try to say that she does not have no abuse in her history. And I know why. I get why she's doing that. And I'm sure that there's truth to it. Whatever. I'm not suggesting it's not true. But I pointed out because we don't know anything about Lindsay's history. I don't know anything about Lindsay Clancy except for her job history, when she got married, and the fact that she was a gymnast when she was 11. I mean, that's what we know. I don't know anything about her mental health. Anything that I extrapolate from that is a guess, because people can be very successful in their lives and look very successful, but be very mentally unstable. And so I suspect there were issues of anxiety prior to all of this. And some people, guys, they can't speak. Like, they're avoidant to the point where when they go to try to tell you their truth, when they go to try to give you deeply personal, emotional information about themselves without having trauma, they can't will themselves to communicate it because it's so terrifying. And I could see the kind of people pleasing that we're looking at here, the kind of self-doubt, the kind of pressured, kind of crazy behavior where, oh my God, that it feels in the same ballpark as what we would expect to see from somebody who's always been unable to voice their truth, their real feelings. Somebody who's scared of other people and has to put on like the perfect has to show up exactly the way they think you want them to in order to be comfortable, which is a horrific way to live. I think most of us, at least many people, kind of have that in adolescence. It's a very adolescent kind of way to see the world, right? Like think about like, 7th grade, the cafeteria. Everybody cares about what everybody else is thinking, and we're all very uncomfortable and awkward, right? It's the way you are as a young kid, right? Because your frontal cortex is not completely developed. You have no sense of self. You care most about what your friends are thinking and like wanting people to like you. And that all makes sense at 12. But if you never grow out of that, and then you become an adult, life gets much harder because now you got to make grown-up decisions. And what are you using to make those decisions if not your own beliefs, your own opinions? Well, I'll tell you, what people default to is what they think they're supposed to do, what paths in life they think they're supposed to follow. For example, oh, I'll be a doctor. I'll be a lawyer because that's how you make money. Or I'll be a nurse because when I was 11, that's what I said I wanted to be when I grew up. I want babies and the white picket fence. But then as you are pursuing those things, you start to realize like, oh, this sucks. And I said I wanted to do this for a really long time, but maybe I don't really want to do this. But at that point, you're dug in because you've already got student loans and you've already made the commitment, right? So in other words, I could see a world where she never completely developed a sense of self and keeps everything hidden, even from her friends, because it doesn't feel safe. But we don't have enough information to really definitively say one way or the other. And that's what we need more information to discern. And the reason why I'm bringing this up is because if that's true, butterfly year 60, you are without a doubt correct. We would absolutely not know or hear. And even to this day, she would likely be afraid to tell us the truth about what she was experiencing. Even after all this, even to save her own ass. So it's possible that that is the case, certainly. At Please Be Real sends $27.99 Canadian dollars. 4 hours. Stamina Sam, great show as always. Also not far away from Koenig case update. Ooh, Koenig case update. I'm so behind. This is the thing that I hate when we get into a trial. When I get into a trial, is then I like start to drift further and further behind. Like I have so much Karen Reed stuff to catch up on. I did see all the Grant things, so I'm caught up on the Sandra Birchmore thing stuff, which is lovely. And it's so funny because I actually knew about Sandra's case long before I knew about Karen Reed. Because of the Case podcast. And I listened to it very closely. It took me, I don't even know, a long time to realize that the same police officers, like that it was so close. I did not realize Stoughton and Canton were like neighboring towns. I just didn't know that until much later. So it's very exciting though. Please Be Real. Thank you so much. Thanks for being here. Thanks for your support. You are amazing. And yes, don't forget to hit the like button, everybody, before we go. Jackie, my beautiful sister, thank you so much for being here, for filling in Wednesday all the way, 7 p.m. We are celebrating my sister, so don't forget to be there. God only knows what's coming in the Lindsay Clancy case, but you can count on me being honest with my opinion. I will tell you my God's honest truth, whether it's the popular thing to say or not. And as of right now, I am leaning in the direction of this woman was very likely experiencing postpartum mental illness and could very well have been experiencing postpartum psychosis. And if that is the case, that I guess is really the ultimate point. it means that she would have had to have been experiencing hallucinations before the command hallucination that she did not tell anybody about. And that's not impossible, because this is somebody who's wasn't telling anybody anything. Even her doctors, she's doing the thing where, it's like, I have a friend who told me once that they needed help for, she's not being forthcoming. She's not saying, I am having overwhelming thoughts of ending my life and even doing something horrible like hurting my children. She's not doing that. Because she's not doing that, the good doctor isn't writing it down, isn't acknowledging it, and if anything is doing the opposite. She's trying to use that as a defense that she wasn't at fault. She didn't miss anything. Lindsay didn't tell her the truth. Well, as Kevin Reddington so rightfully did point out, she's the patient. She's very mentally unwell. No matter how well she's able to put her best foot forward and people please all day and use the right lingo and ask for the medicines, the whole thing, you're the doctor, you're trained, allegedly. You need to know when that's what's happening. When somebody is not faking in the way that they're malingering, but when is showing up to put their best foot forward and really is hiding the true extent to which they are falling apart, disconnecting from reality, which is what I suspect happened here. You guys are amazing. Thank you so much for being with me for 4 hours and 30 minutes. Everybody, send your most heartfelt blessings to my Denise and Bugsy, and we hope and pray that he is 100% better very, very soon. Thank you so much to my sister, and thank you to all of you guys for everything that you do, for your contribution, for being here. You are the very best, and I mean it with my whole heart. Everybody, I will see you in just a few days on Wednesday night, 7 p.m. We are celebrating my sister. Enjoy the trial, and I will see you back here in what will feel like no time at all.
It is the defense counselor's duty to protect the rights of the individual, as it is the prosecution's duty to uphold and defend the laws of the state. Justice for all. Only we have a problem here.
I live inside my own world of make-believe. Kids screaming in the cradles, profanities. I see the world through ice covered in ink and bleach. Cross out the ones who heard my cries and watched me weep. I love everything. Fire spreading all around my room. My world's so bright, it's hard to breathe, but that's alright.
This is me reminding you to like this video. Like the video. I promise if you get up right now and you like this video, I will never sing again. Comment, subscribe.
I won't mind your moves. You'll get along.